Welcome, everyone. I'm Pat Kinney, and I'm joined by my colleagues Gaurab, Basu, Heather Clifford, Zachary, Popp, Rachel, Nethery, and Amruta, Nori-Sarma. We will be, for the next few hours, walking through a sort of a demo educational session related to climate and health. We're going to start off, myself and Gaurab will talk a little bit broadly about how climate change affects, and also how we can take action to help solve that problem. We'll then transition into a session led by Heather, who will talk to us about climate data, accessing it, processing it, and especially visualizing it. And then for the last bit, Rachel and Amruta will lead us through an example of a data analysis that uses typical code and also sort of data sets that are very, very commonly used in the climate and health field, just to give a feel for that kind of analysis. I think in general, this session probably targeted primarily at relatively new investigators in this arena, but we welcome anyone who's interested to take part. There's an opportunity to submit questions in the chat and probably in the Q&A as well, and those will be tracked by our colleagues. Let me move to the next slide, bro. Thank you. So the first bit is a session we're going to call Climate and Health Impacts and Solutions. And I'll start off, and then I'll pass it off to my colleague Gaurab in a few moments. Next slide, please. So this slide helps I think remind me that first of all, that our atmosphere is a thin layer that separates us from the void, and the void is large, and we have to think of our atmosphere as a very precious resource. And also, it's sort of the global nature of this issue can be overwhelming, but also reminds me too that as we mobilize to address climate and from a health perspective, we have a lot of tools already in our toolbox to start solving this problem. And I hope we'll give you a flavor for that today. Next slide. This is a chart that I just downloaded recently from NOAA, National Oceanic and Atmospheric Administration, showing the average global temperatures from the time when data become reliably available in the late 1800s till 2023. These are just averages. You notice there's a lot of variability from year to year, but look at that trend that's so apparent starting around 1960 or 1970, with a rapid rise in global average temperatures that's actually been accelerating in the last couple of decades, with 2023 being the hottest year on record on a global basis. Next slide. We talk a lot about average temperatures, 1 degree, 2 degrees, that sort of thing. It doesn't maybe sound like a lot, but when we keep in mind that there's a distribution of temperatures, and it's often the extremes, especially at the high end, that really drive health impacts. And this could be true not only for temperatures, but also for precipitation, storm events. And so shifting the average of a distribution just a little bit to the right side ends up increasing the weight in the upper tails quite substantially. And this is illustrated from this little schematic plot of a normal distribution, where the amount of the number of days that fall into a hot category, however we wish to define that, nearly double with just a slight shift in the mean. Next slide. And it's not just about temperature, it's also about changes in the entire Earth system, including sea level rise, larger coastal storms. Next slide. Inland storms that drive migration and potential conflict. Next slide. Extended droughts that affect people's livelihoods, especially in agriculture, and people that live close to the land around the world, causing real problems with food security. And next slide, and it's all related also to air pollution. This is a picture showing particularly hazy day in Beijing a few years ago. So moving on to the next slide. Thanks, Gaurab. We're fortunate to have the Intergovernmental Panel on Climate Change, which every 5 years or so does a big global assessment with the world's leading scientists that work on climate change, assessing the evidence. And the most recent report, which came out in the last year or two, came out, gave us these important conclusions. And the first one is the strongest, most unequivocal statement that's ever been made by the IPCC about the fact that human activities, principally through greenhouse gas emissions, have unequivocally caused global warming. And those emissions, based on the evidence we have, continue to increase, but with unequal historical and ongoing contributions, as we'll see. And that has resulted in rapid changes in the atmosphere, the ocean, the cryosphere, the biosphere, which has led to widespread adverse impacts to nature and people. And vulnerable communities who have historically had the least responsibility for the current change in climate are most disproportionately affected, which really makes this a global environmental justice problem on a huge scale. And then finally, although we are hoping as a global community to keep our change in temperature below 1.5 or 2 degrees, right now, as a globe, we're on the track by the end of the century to reach 3.2 degrees Celsius. Thank you. Next slide. Next slide, please. Thank you. Just to give a sense of what parts of our culture and economic systems are most responsible. This is a chart showing global contributions to greenhouse gases across different sectors of the economy. You see that electricity production and also food, agriculture, and land use and transportation industry are responsible for the bulk of this. These pie pieces will differ in different countries, but this global picture gives us a pretty good idea of what's responsible for the climate change that we're observing. Next slide. And if we track greenhouse gas emissions, in this case is fossil CO2 emissions charted from 1990 to the present time, we see a gradual upward trend, although there is evidence of a leveling off on a global basis. There are, including some important dips during financial crises and the COVID pandemic. And then that's right, you can go on to the next one, it's fine. Yeah. And we're not all equally responsible. It's particularly the developed world, in particular the United States, historically, it's had the largest share of cumulative CO2 emissions that are responsible for the climate change that we're observing. China's catching up rapidly, and many other developed countries as well. Next slide. What does this mean for the future? Climate scientists who contribute in part to the IPCC reports, and I think I definitely got this chart from the most recent report. They have models that can project the future based on different assumptions about how we as a global community take action now to mitigate or reduce the emissions of greenhouse gas. And you can see that even under the most optimistic scenario, if we get to the 1.5 degree sort of max change, and I think use the right-hand y-axis, which shows the temperature changes relative to pre-industrial times. So there we can sort of track the 1 to 1.5 to 2 degree changes. And the most optimistic scenario that's examined by IPCC, even there, we expect further warming to occur by mid-century. And so the trajectory we're on right now of extreme storms and extreme heat waves is only going to get worse. It may start to get better if we're effective in controlling greenhouse gases by the end of the century. But some of the other scenarios, like the one that we're currently on, which is sort of in the middle part, gets us up to about 3 degrees Celsius by the end of the century. Next slide. And I just wanted to mention that that was temperature. Sea level rise is a much more difficult beast to control because of the inertia in the ocean system. And so even under the most optimistic future scenarios, sea level will continue to rise through the end of the century and beyond. So I think that points, as health scientists, I think increasingly this century, we're going to be dealing more and more with trying to understand the health impacts of extreme coastal storm events, which are already major sources of ill health, but will only get worse. for quite some time. Next slide. Turning to solutions to the climate crisis, we really have two approaches. There's mitigation, which refers to reducing emissions of greenhouse gases or enhancing the sinks to remove greenhouse gases from the atmosphere. And then secondly, adaptation, which are measures to reduce vulnerability of our systems to the ongoing climate change. And we need to do both. We want to get ourselves on a low future trajectory through mitigation, but we also realize that the climate's already changing quite rapidly, and therefore we have to adapt, and we will continue to need to adapt throughout this century and beyond. Next slide. So how can we as public health researchers inform these critical climate solutions? Well, using epidemiology, risk assessment, and also basic science, we can first quantify the magnitude of current and future climate-related health impacts, which can provide a fuller understanding of the adverse effects of climate change. We can also identify, prioritize, and evaluate effective adaptation strategies using that kind of evidence, and also evaluate and prioritize the health co-benefits of mitigation actions, all of which will help us develop more effective health promoting and equitable solutions to the climate crisis. So public health research has an incredibly important role to play across all of these areas. Next slide. I'm going to pass off to my colleague Gaurab and carry on from here. Thank you.
Thanks so much, and hope you're all doing well and enjoying the conference so far. And thanks for your engagement in this most critical issue. So I'll continue the conversation here, and here's a little bit of a diagram that helps us organize the different mechanisms. So there's numerous mechanisms. Each of them are complex. We can organize them in different ways, but I have found this organization of the mechanisms helpful. And maybe I'll highlight, in the middle here with the red or the pink circle, mental health really permeates through each one of them. And I think that's important to recognize as well. But, for me in my journey of doing this work of public health and climate change has really taught me that the impacts of climate change hit directly upon all the things that we care about in public health. And so why is health important? Sometimes, when I'm in other spaces, folks say, what's the point of public health folks and doctors getting involved in this? I can't make a solar panel or know, how to get a battery to work better or how to, create some of these clean energy systems that we need. But I'll make an argument that actually we play a very unique role that no one else can really play, and that putting health at the center of this conversation is fundamentally critical. I'll make the argument that we're uniquely positioned to be storytellers, to make this human, to make people care. But health is fundamentally about values and quite powerful ones. And by doing that, I think we can clarify the impact and create urgency. Sometimes people won't react to hearing that a pollutant level is increasing, or that an emission graph is showing, changes in emissions over time. But when you start putting that human face in front of people and explain the way it's impacting the people and things they love, I think it's a foundation for a moral conversation about how we make a fair and equitable future. And certainly, there's this need to have some imagination and kind of dig into the work of transformation, because we do need truly ambitious and transformational change. So I'm a primary care doctor in addition to my public health work. And so I'd like to tell you about a patient of mine. This is our emergency room at our safety net hospital. And I had not met this patient at the time of his first interface with our hospital, but he's a 30-year-old man with asthma who had moved to the United States 5 years prior from Central America. Back home, he was a farmer and had these upper respiratory symptoms. Thought it was a cold, was kind of nagging for a while, but his family was starting to kind of nudge him to get evaluated. He had not established care with any health professionals in the United States yet. but he was a little reluctant to do so, but then started developing shortness of breath, orthopnea, meaning he was feeling more short of breath when he was lying down, headaches, and fatigue. And so finally did go to our emergency room. I think thought he might have had a pneumonia and was hoping for some antibiotics, and had a really devastating and completely unexpected diagnosis. So these are labs, for those of you who may not be familiar with some of these lab findings, evaluating his kidney function. And his creatinine was an extraordinary 11.8, far higher than expected. His GFR was only 5 when we expect that to be above 60. So this was a completely unexpected diagnosis for this young man. And we found that he was in acute on chronic renal failure. He had to be hospitalized and dialyzed urgently. He came to my primary care clinic after this hospitalization. He remains my patient, and I've known him for a while now, and he has written about him with his permission. And really, for me, I met this patient, kind of in my journey of kind of waking up to the impacts of climate change on health. And for me, if there's one patient I've cared for that immediately comes to mind when I think about this, it's him. Now, you could say, well, Gaurab, what is this connection between climate and this kidney disease? He was a young man with so after the evaluation, he was found not to have any intrinsic renal disease. He didn't have diabetes or high blood pressure, which are usually things we think about with chronic disease. Folks who are older and chronic disease can have this, but he had none of those things. And after a very thorough evaluation, he was found to have CKDU, chronic kidney disease of unknown origin, also known as Mesoamerican nephropathy. I think probably the best term here is heat-triggered renal disease. And while the interface of heat and renal disease, this phenomenon, is complex, and there's other factors that are being assessed, like pesticides or other environmental exposures. Ecological studies, my read of the literature, it makes me very confident to say that heat played a major role in impacting my patient's health. And he was a farmer out tending to crops year in, year out since he was a young child. And he was getting dehydrated. He was out kind of putting his body at risk. And with that hypoperfusion of his kidneys, because of not having enough blood flow to it, because of dehydration, his kidneys were slowly getting injured little by little over time. And to the extent that, he was not able to tell that this was happening because his kidneys were compensating until he had a kind of a profound a presentation in the emergency room. And so again, I met this patient at the time. I was making these connections myself, and he remains kind of one of those faces I see when I think about the impacts of climate change. I won't go in great detail into all these different mechanisms, but this is just to highlight that when we think about climate change and the kidneys, there's complex interlocking mechanisms here of the ways in which ecological change and the changes in our atmosphere impact the interface of a human physiology. Again, I'm highlighting the kind of temperature element here for my patient, but there are many factors at play, including on the delivery of care, not just on the impacts on health. So let's talk more about heat. So this was kind of a case example of heat, and let's talk more about that. It's important to recognize that our body works very hard to maintain a core temperature, and when there is heat stress in our body, our body works very hard to maintain that. Mostly by sweating. We shunt blood flow to our skin to help us sweat off heat that's inside of us. We increase our cardiac output, and so this helps us, maintain that temperature, which is kind of the compass our body is following to ensure stability of our health. But when we are not able to compensate, many mechanisms start getting aggravated and can lose its capacity for maintaining that core temperature. And then some feedback cycles can play out. And so with an increased core temperature, you start having things like cell anoxia and gastrointestinal permeability problems and cardiovascular challenges and inflammatory pathways. And then you can see here how many organs can be impacted by that. And of course, in its most dramatic presentation, this can manifest in heat stroke. It's important for us to recognize that studies have been trying to elucidate the role climate change has on extreme heat. It's believed that up to 37% of heat-related deaths are related to anthropogenic greenhouse gas emissions. And that, I think, is quite striking, that climate change is causing such an increase in the rate of deaths. Heat is one of those very intersectional issues. It impacts all the things I care about as a public health person and as a primary care doctor. And I'll kind of provide a couple examples here of the ways in which the impacts of heat on health are widespread. This is a study by Amruta that was showing increased utilization of emergency room mental health services and was able to show an increase in not only mood disorders like anxiety and depression, but substance use disorder, suicidality, schizophrenia. And so when it's very hot, people don't do as well. And then, of course, often it's based on the change from baseline, and there are factors here of how people are able to compensate. But it's important to recognize the impact heat has on mental health. Here's another study by John Jay and a number of investigators that were showing increase in gun violence on very hot days. And interestingly, when communities were increasing their tree canopy to mitigate against the impacts of gun violence, they were seeing fewer shootings. So again, you just see the ways in which heat has these many intersections on health. I want to just make sure I put the framework of environmental racism here at the forefront. Dr. Robert Bullard is considered here in the United States as kind of the godfather of environmental justice, and he defines environmental racism as any policy, practice, or directive that differentially affects or disadvantages individuals, groups, or communities based on race or color. That includes exclusionary or restrictive practices that limit the participation of people of color in decision-making boards, commissions, and regulatory bodies. And so it's not only about the policy itself, but also who is able to participate in the decision making. And of course, environmental justice is the movement to stop environmental racism. And so these inequities, these kind of processes, these oppressive forces manifest in many different ways across the world and different communities within each country. But there's a fundamental issue of fairness and justice that is at the core of this work of climate change and environmental justice. And using these frameworks help us understand the historical and structural factors at play that have allowed disproportionate health outcomes. Here's one other example is for reproductive health. This is kind of one of those that keep me up at night and really, again, come to my mind's eye immediately when I think about climate change and burning of fossil fuels impacts on health. This was a meta-analysis that came out in JAMA in 2020, showing that there was an increased association between air pollution and heat with premature birth, low birth weight, and stillbirth in the United States. And when they did a subgroup analysis, they found that Black people were disproportionately impacted. Just say a word here about Indigenous health and Indigenous rights and Indigenous frameworks and understanding solutions and ways forward. I found this quite striking, that in the world's Indigenous people, the 370 million Indigenous people around the world, make up 24% of land masses across the world. But in those land masses, only 24% of all land masses make up 80% of the world's biodiversity. And so I'll just make a point here that, certainly I think many of us think immediately about ending the use of fossil fuels and replacing it with clean energy and clean transportation. And that is at the forefront of this work. But this kind of stewardship of our natural resources, writing our relationship with nature, we'll talk a little bit about the role of biodiversity and ecological stability, but it really I believe this work in public health, challenges us. Pat showed you the numbers for food and land use changes on emissions as well, challenges us to do even deeper work of writing our relationship with nature. Because we have been and will be talking about wildfires a lot this week, we'll just make a point here of, climate change and wildfires are kind of one of those interfaces in which many factors are happening at play and kind of create some cascades of impacts. So climate change, of course, increasing temperatures, and this is increasing wildfire risk, which has many health considerations. So what happens is that as temperatures are rising, forests become drier, the soil is not as moist, the snow melts that's critical to hydrating these forests get complex because the snow melt sooner, and the reservoir of the slow trickle down from the mountaintops are disrupted, and that creates the tinder for any kind of major event that could begin a wildfire. And the data is striking. You see here that the average number of wildfires per year has increased significantly over recent decades, and the average length of the wildfire season has additionally increased as well. These are United States data points. And again, we think a lot, there's great concern that the particulate matter pollutants and emissions from wildfires might be particularly dangerous to people's health. This was a nice study by Jen Stowell and Andrea Hanley that showed increased respiratory outcomes here from wildfire exposure. Did not show as much on the cardiovascular front, but did show that that there was an increase impact on respiratory disease from wildfire. Just want to say a few more words about climate change's impacts on global health equity, and put again a kind of a global frame to this work. Here on the left, you'll see the kind of warmer red colors show which countries are most responsible for carbon dioxide emissions over time. You can see it's mostly the wealthy countries, the global north, Western countries. And on the right here is a schema developed by Jonathan Potts that shows the disproportionate mortality from climate-related diseases. And you can see that's disproportionately in the global south. And so again, there's a fairness issue here. I'll talk a little bit about this in a second, but you picture families and communities around the world who have done very little to contribute to climate change, and yet they're bearing the burden of this. And they're looking, across the world, asking us how it could be that we continue doing this and leaving their lives in peril when they have very little power to do anything about it. And so my own personal history, my family is from West Bengal, India. And so it's always been kind of important for me. I've been working with nonprofits there, especially one called the Child in Need Institute, since I was a student. And of course, the Bay of Bengal area, both in Bangladesh and West Bengal, in many ways is at the front line of the climate crisis, with it's an area that has always been impacted by cyclones, very impactful cyclones. But in recent years, we've been seeing the increase in the Proceeding of National Academy of Science had a major study a few years ago showing that the frequency of super cyclones is increasing. I just saw that there's consideration now creating a new category of Category 6 hurricane cyclones because of the unprecedented power that we're seeing from the impacts of cyclones. And so this was reports coming out for Cyclone Mocha that there was great concern. Thankfully, in the end, it did just move out of the way to not impact the Rohingya refugee community in Myanmar. But I put this slide up just to show these kind of intersecting issues of health inequities. You have a refugee community already having great challenges to have their basic needs met in an area of the world in which there are major cyclones that climate change is exacerbating. And so I think a lot about communities that not only have to face these threats year in, year out, but you see here in 2019, it was Cyclone Fani, then in 2020, Cyclone Amphan, in 2021, Cyclone Yas, and then Mocha last year. It's not, so these cyclones come through and just devastate these rural village communities on the coastlines of the Bay of Bengal. Having the events of the disaster and the impacts of that right away, and the devastations on homes and other infrastructure. But even in addition to that, then you have the impacts of the breakdown of health services. A lot of the community health workers that are providing nutritional services to children, trying to get kids into schools and keep them there, it impacts them on many health fronts, impacts their economy. Organizations I've worked with have worked so hard to keep children in schools so that they can have an education when there's this kind of economic devastation. Many of the children are pulled out of school so they can help their families rebuild. And I'm struck that, after that rebuild, they have to face the threats year in, year out into the future. And so we're having this conversation about reparations. We can call it different terms. I was in in Dubai for COP28 in December, where the loss and damage fund was operationalized with $700 million. We believe it needs many, many times more than that to try to address the loss and damage of the global south. And there's a question, again, going back to these issues of fairness, of what responsibility countries who have disproportionately contributed to climate change have to help the global south adapt and respond. And I will say, make an urgent transition directly to the clean energy resources that are readily available and very cheap now, rather than going through fossil fuel development, as well as many of these countries are developing. Here's a US slide just showing that climate change is very expensive. In 2022, there was 22 $1 billion natural disasters. With climate change, we can expect these kind of events to increase. And I touched upon this, but just a word again about the disruptions to the healthcare delivery system itself. When Hurricane Maria in 2017 just devastated Puerto Rico, here in Boston, many of my colleagues in the emergency room had a very extraordinary experience where they did not have enough IV fluids. And so colleagues in the emergency room were giving patients Gatorade to try to rehydrate them, because there was the major IV fluid factory is in Puerto Rico. And because of the hurricane, there was a shutdown in their services. And of course, within Puerto Rico itself, there were studies showing delays in care and disruptions of care for months on end because of the electricity and infrastructure of the healthcare delivery system. I'm just going to say a brief word about infectious diseases here, a huge topic that we could go many directions in. Of course, mosquito-borne illnesses, tick-borne illnesses, and the ways in which we are redistributing infectious diseases, many issues of migration, and how that impacts infectious diseases. But I'll maybe just make this point. Of course, we're all thinking about pandemics and pandemic mitigation, and of course, the critical role that vaccines play in preventing the spread of pandemics. But I want to make sure that we're not leaping past the point that I believe one of the most critical ways in which we mitigate against the risk of future pandemics is investing in planetary health. And so this conference and many of our conversations is anchored in climate change and emissions, but it's important for us to really embrace this broader work of planetary health. And so when I teach at the public health school and the medical school and show pictures of ecology in our forests and this kind of extraordinary delicate balance we have around the world in our natural world, and the extraordinary species we're around, and just the magnificence of the diversity of our species population, and of course the great crisis we have in those species dwindling. It's actually quite important, I think, to make the connections to human health. And of course, with zoonotic diseases, diseases that start in animals, the more we encroach into natural spaces because of deforestation, because of runaway agriculture, because of misuse of land and water, we are encroaching into natural spaces where these zoonotic diseases may be living in equilibrium with, an area that has immunity to it. But we've seen here that when when there's a spillover event into the human population without exposure history, how profound the impacts are for public health. And so it's critical, I think, we be thinking in these terms of protecting our planet to be mitigating against future pandemics. So I'll just make this personal a little bit here and just tell you, in my own journey in this work, I'm a global health person. I've been working abroad and for a long time now, but frankly, did not see it all. I was climate change was all around these issues I cared about when I was working for these nonprofits in Liberia and West Bengal, India. Thinking about issues of nutrition and safe water and having these coastal communities be safe from events, from extreme weather events and all that. I was not appreciating the way that climate change was right there and impacting all the things that I needed to be working on. And Pat reported out some of the IPCC findings. It was the 2018 IPCC report that really shook me. And frankly, just it was quite a tough process for me to really wrap my arms around how serious, how severe, how urgent the issue of climate change is for all the things I care about as climate change. And so, I toggle back and forth through the different roles I have as a primary care doctor, now seeing the way it impacts my patients in the local community here, as a global health, public health person, understanding its impacts around the world, really embracing the challenge of these issues of fairness and justice. And I think where I've just landed is that we need to have a spirit of transformation and imagination and determination that just because we did things a certain way over all these years doesn't mean we need to do it differently. I think we've got to ask ourselves some foundational questions about what is needed for health, and not just to enter into new spaces where maybe we didn't feel were public health spaces before, but in fact truly are, by thinking about entering into spaces of clean energy transformations and transitions, food systems. Of course, we are in the space of nutrition, but really thinking about food reform and food policy, the health within our homes, within our buildings, not only for ventilation and air quality indoors, but also for the emissions that are coming out of our stoves and furnaces. And again, to really be thinking about forests and biodiversity and the ways in which protecting nature which is a foundational investment in public health. So what are the roles we can play? There's many, and so I'll offer just a few of these, but my greatest hope from your engagement in this program is that you will reflect upon what it is that matters to you. What are the issues that you care about, what you're passionate about, what your skill sets are, what your community is well positioned to work on, both institutionally and your local community. There's something here for every single person. And a message I really try to convey is that this is not about anyone fundamentally changing their work or becoming a different kind of professional. It's really, anchoring on the work that you do, having the skill sets that you have, and bringing that to bear for the climate crisis. And then so what the challenge about climate change is impacts everything in public health. But the opportunity is that everyone has a really opportunity to contribute. But it does take some work to dig into some of these mechanisms and connections and understand how we can be putting a climate lens on our public health work. But here's some offer, I offer this just for consideration and reflection, ways of taking action. Of course, there's the personal responsibility role. My family, we work to kind of get all the gas appliances at our home. We had some privilege to be able to do that and save up for that. And we certainly need a lot of policy and systems change to be able to allow that to happen around the world. Of course, research, teaching, I think that we've got some real gaps that we have across public health institutions around the world of how we're teaching and empowering students to become the next leaders. I really believe in policy. I think there's profound change we can make by making the right policy and having the right leaders guide us so that we can be studying this and having evidence-based solutions be a part of our solution making. I think it's quite potent for public health folks to be writing about their findings. We are all very proud, and it's a great impact to get our work published, and that's of course the foundation of our work, but I think it doesn't end there. It really is communicating and explaining those health impacts to the public forum so that people can understand what's at stake. And then narrative and advocacy. And you'll have to consider what that looks like for you or what that matters. But again, I'll come back to that storytelling work. I believe that marrying the data work, the research work with the storytelling work, we know in the change-making, literature that people don't respond just to graphs alone, that knowing the data is a really important thing. I'm here in clinic today, and we'll be going back to seeing my patients, and knowing the data is my core responsibility. I love data, but telling stories about what we're seeing and why it matters and why it's human, and connecting with people at an emotional level is a really important supplement to that. And I think that public health can be considering how we could do better in those domains. So I'll offer you these questions to consider. What systems do you want to change? What communities do you want to be a part of? Where do you find your power, strength, and inspiration? What roles can help you be most effective? What issues do you want to spotlight? What world do you want to make, and why? Here's a photo here of a piece that was written on our work to incorporate climate change into medical school. We now have a 4-year curriculum there. We're working on the same thing at the Chan School. BU has a really great program in teaching their public health students climate change's intersection with public health. The hospital systems themselves, we're talking about how climate change impacts health, but again, to go back to healthcare delivery, this slide says 10%, other studies show 8.5% of US emissions are from the hospital sector itself. Here in the United States, HHS, Department of Health and Human Services, has created this challenge for hospital systems to decarbonize by 50% by 2030 and to end all their emissions by 2050 and have a senior executive involved. Public health folks could play a big role in explaining, the health benefits of that. There's this time where I was walking out of our hospital and there was, a shuttle. I was reeling in a wheelchair, a patient who had a COPD exacerbation, finally stabilized. And I wheeled him out to wait for his family, and we were waiting at the curb as the shuttle was just sitting there idling with its engine on, pummeling my patient with a lot of pollution. And so we could be thinking about, how to have sustainable food and clean energy and electric shuttles really be, the way that we do things in the hospital systems. So for me, at least, again, I bring kind of my own experience to this. I think, there is this fundamental piece here of hope and despair, and how to take on big things. We're all seeing these headlines. Many of you live in countries where I'm seeing the impacts of climate change. I'm thinking about the families and communities impacted, and frankly, it breaks my heart. And many of you have undoubtedly seen the impacts firsthand. And we know that these impacts will get worse. We need to be mitigating aggressively and adapting to this. But part of, I think about my grandparents. I told you a lot of my work in West Bengal was inspired by their lives. They lived very tough lives in a lot of poverty, and was able to show up to challenging circumstances and keep going. And I think of them in this work. And so how to see these challenges and still have a sense of courage to show up. I think it's also important to know all the things that are happening. And so for me, at least, it's a little disorienting to see unprecedented impacts of climate change on public health and safety, but also unprecedented breakthroughs in climate solutions. And so here's, in the United States, a slide showing a real freefall decrease in the use of coal, which is continuing to decrease, to the current day. This slide, I know, is a little bit hard to read, but the graphic, I think, is important. You'll see the red orangish line that's the biggest slope downwards is a dramatic, unexpected, no one could have thought that solar would decrease. This is a slide about cost decreases over 2009 to 2019. there's like an extraordinary, unprecedented decrease in the cost of solar within 10 years that has completely changed the conversation for the clean energy transition. And then the next biggest slope downwards is onshore wind. And so now renewable energy is the cheapest form of energy across the world. We need to be providing, addressing energy poverty, providing good clean energy across the world, having batteries and the rest to support the grid, to help communities develop economically, but to jump onto the momentum of the clean energy transition. This is a very busy slide. I'm not going to go through all of it, but I'll guide you through it. So this is energy capacities installed. So capacity, like what is being installed as new energy sources. So in 2007, this is a global slide. 2007, 46% of all global energy installations was coal, 21% natural gas, 14 hydro, which is good, clean energy, 10% wind. Fast forward to 2021, and you'll see that 4% of new installations were coal, 11% natural gas, 7% hydro, 25% wind, and look at solar. So you can see from this slide that about 82% of new installations around the world in 2021 were clean energy. I think we can get to the place where we say all of it should be clean energy and that we can be retiring our fossil fuel infrastructure. Here's another schema that I won't go in great detail, but just shows from current day into the future. Green there is solar, nuclear is black, hydro and onshore wind are the kind of red and yellow colors. So you can see that there's many estimates here showing dramatic increases in renewable energy in the coming decades. With the things that Pat were telling you about where we are and how fast the crisis is exacerbating, we shouldn't take any we shouldn't take any we can't get our foot off the gas pedal here, the gas pedal of an electric vehicle, but we've got to keep going. We've got to be working with urgency and use this momentum to keep building on the gains that we've had in the last year. Here, speaking of electric vehicles, is exponential growth on the acceleration of electric vehicles around the world. A lot of this has happened from China. The rest of the world is catching up to some extent now. Transportation, let's just make the point that it's not just about switching from internal combustion engines to electric vehicles, but also thinking about active transportation where people can walk and use public transit. But the internal combustion engine peaked in 2017 and has been decreasing ever since and being replaced by electric vehicles and hybrids. And so we can work on these gains to end the use of fossil fuel engines for transportation. Here's another slide showing people's attitudes over time. So on the top here is asking people how concerned they are about global warming. In 2013, you can see the numbers for alarmed and concerned and cautious. And look at how much they've increased till 2022, over 9 years, a significant increase in the number of people alarmed and concerned. And yes, there's still some people who are dismissive or, really disconnected from this issue, but I'll make the argument on the left side of these diagrams show profound, majority of people who really want to get to work on this and put solutions in place. The United States here, Pat made the point of, who has made, the emissions and who has responsibility. Certainly the United States has a long way to go, but in that green line here, the Inflation Reduction Act is a really important policy that was passed recently and promises by this modeling to decrease emissions by 40% by 2030. Paris Agreement that the US has agreed to is decreased by 50% by 2030. And so this was an important policy for that pathway. Say another word about natural solutions. I'm obsessed with trees these days. When I go running, I'm always calling the city of Cambridge here to let them know when a tree is dying or needs. They're probably annoyed by me by these days, but they are actually very responsive, I'll say. But trees have so many health benefits by cleaning our air, by mitigating against the impacts of extreme heat, mental health, physical health. And so we got to be thinking about how the basics that we have available to us can help public health. And there's a lot of major treaties and important things that are being approved that sometimes don't get as much news as they should. You know, this was a major international agreement to protect biodiversity in international waters, to preserve 30% of the planet's land and seas from the impacts of decreasing biodiversity that the UN ushered through in recent years. This is a big deal. And what I take most heart in is that as I see, around the world, climate change is hard to communicate. It's hard to explain when people have, basic needs of their lives day in and day out, right? People are trying to take care of their families and take care of their basic health. To explain to people how heat and air pollution and extreme weather events, infectious diseases, it is actually hard to help connect the dots, especially I will argue, because there are a lot of sources of misinformation out there. And so I see us as ambassadors of health, to enter the conversation, help people see those connections to health, see how it matters to the things and people they love. And look, the students I know that we work with across the world here, I'm sure you all have seen it as well. They get it, they're passionate, they're worried, they're upset, and they're an extraordinary source of power that has really changed the conversation in the last few years and gives me a great deal of hope. There are models out there that show that if we are able to secure and execute on our pledges, that we may be able to abide by the Paris Agreement. But again, there's many factors at play here, and we need to continue on. Here, I'm just wrapping up here, but these are US emissions over time. Pat showed you kind of the global emissions. I'll show you the US ones here. And the light blue are where the United States needs to get to abide by its Paris Agreement of reducing emissions by 50% by that time. And listen, the United States, they've in many ways have not had a laser focus on doing this. And even still, you can see that for me, of course, this seems possible. Of course, this seems like we must do it and can do it. I have no other reaction to this slide other than, of course, this is possible. I think of Dr. King's voice that the arc of the moral universe is long, but it bends towards justice. And I think it's important for us to feel like we're a part of something bigger than ourselves, that all of us on this webinar, those of us around the world, bringing our talents and skill sets to bear, to pull this arc down, to bring the emissions down, to put health and justice right at the beginning of this work, to know that, we can do our part and that we're a part of something bigger and that we can be making that world that we all deserve. So again, climate can feel very daunting and overwhelming and feel like how could I ever enter into this work? Please consider, reflecting again of how well positioned you are, how it's really at the heart of what you do. And the whole point of this whole thing is to build community together so that we can find our way forward on this journey. All right, thank you so much. I'm going to turn it over to Rachel.
I think we'll pause for a second. Thank you, Gaurab. That was really fantastic. We're going to pause for a second and take a check in with the questions that have been coming in from the audience before we move on to the transition slide.
Great.
So here's one that I think I might I'll pose it and then I'm going to volunteer to answer it because it's one that I think I might at least get a start with an answer to. In most epidemiologic studies in climate change, the definition of climate change is quite restrictive. For example, air pollution or extreme heat, which are more measurable and acute than our common sense of climate change in the lay people's view. What are some ways to measure the more comprehensive and long-term effects of climate change? I think this person has really put their finger on a really important limitation of the research that we've been doing so far, and it really gets at the idea that we're kind of like the famous drunk looking for their glasses, but only focusing underneath where the lamppost is because that's where they can see. We have certain tools that work pretty well when we have a very restricted set of data, like one exposure out, variable, one outcome variable, and we know how to do those kind of regression analyses. But as you said, as the person said, the climate change exposure are much more complex than that, and that's not just only true of climate change. It's true of a lot of other environmental stresses as well. So I think increasingly we're developing, trying to develop tools that can look at climate more comprehensively. Another aspect of the question was sort of acute, and where climate change is a long-term gradual thing, with acute spikes that occur along the way. But our tools epidemiologically really focus on just the acute part. We don't really know too much about how to look at the long-term changes and how they're impacting health for a variety of reasons, in part because it takes a long time to do those studies. But I think so. Anyway, you've raised a really good point. Maybe I'll ask Rachel if you'd be willing to weigh in about whether and also Amruta, whether the tools that we are now applying are beginning to take into account a more holistic view towards the exposures and outcomes.
My sense is that the methods are there to do this kind of multi-exposure work that needs to be done. I mean, of course, there are caveats to that, but in general, I think the methods exist. It's a matter of getting the data to monitor and measure all of these different things, and even figuring out what all needs to be monitored and measured to try to characterize this. Is my sense is that that's the bigger barrier, but curious if Amruta has other thoughts.
Yeah, I think I would agree with that. And one of the things that I would mention is that this idea of interrelated hazards, climate relevant interrelated hazards, is one that is very much of interest in the research community right now. And the methods that we have for understanding the risk of exposure to multiple hazards simultaneously is something that I think a lot of different folks are looking at and trying to work on. And it's one of the remaining research gaps that I think is left to be addressed in this area of work.
Thanks. Yeah, thanks for pointing out the gaps. The data gaps are especially, that's another aspect, is we only can analyze what we have data for. And we only have data for a few things, unfortunately. So there was another interesting question from Andrew in the chat. This is the comment, and I'll see who wants to address it. Given that environmental racism has the effects that have been shown by Gaurab in his talk, does it follow that environmental ableism also has an effect on climate and health outcomes? So I had to go look up what environmental ableism is. I wonder if Gaurab, if you feel like addressing that. I think
sure. I can certainly start off. Look, I totally agree. And what climate, there you can go down the list that climate change exacerbates, the inequities we see. There's issues of power and disempowered and resource and unresourced. And there's in any community that we can organize around and kind of put a framework on, if there are increased, severe weather events that are impacting the delivery of care, that's going to really impact issues of ableism. When you think about the homeless communities, right, of housing, being an issue, that's going to disproportionately people who are not housed. And so we've got these issues in society around the world of how we create resources to support health. We've got obviously a lot of inequities and a lot of structures that are barriers to us doing that as well as we could. And climate change, for me, my analysis of all the studies just show a continual kind of hit on those kind of inequity fault lines. And I'll say on the flip side, if we do this right, we could be decreasing those inequities so much. And so those kind of frameworks, I think, are valuable to help us understand, what's at play here in public health terms.
Anybody else want to talk? Otherwise, I'll move on. There's one quick one, which is, will the slides be shared? And I think Amruta might be able to tell us. I know the recording of this will be available. Are we also sharing slides? I guess in a sense that'll make it available.
I think we can make the slides available after the session, but yes, the recordings for the sessions will also be posted after the conference wraps up.
Cool. And then there's one other question that I think we should move on in the interest of time. But this is a question from Edison, who asked, how can we share lessons learned and good practices about the impacts of climate change on health with public health institutions working in the global South? I wonder if the CAFE program has something to say about that. Amruta, do you want to address that?
Sure. Well, I'm really thrilled that we have this question coming in from a member of our community, because in fact, that's what our Research Coordinating Center is aiming to do, is share best practices across different communities and share resources, share infrastructure, share our understanding of the health impacts of these different climate-related exposures. So hopefully you're able to join for some of the sessions that CAFE is focused on throughout the conference. We're developing methods for documentation, for data reproducibility and transparency through some of the data management resources that we're going to be providing through CAFE. And we're also going to have opportunities to network. We'll have continued sessions such as these webinars. We're also hoping that as part of our capacity building efforts, we'll be able to provide access to additional free or low-cost training materials and resources that people might need in order to build up their research agenda. And then lastly, but certainly not least, we're hoping to have a mentorship network where people who are more experienced in this area of expertise can provide their feedback and their experience to early stage investigators, junior investigators who are looking to start careers in this area. So I think overall, through the Research Coordinating Center, we're hoping to provide access to some of those lessons learned and best practices for communities from all around the world. And one of the other things that I would really encourage is that we have a series of opportunities to provide feedback to our CAFE team. We'll have a conference wrap-up survey. We'll have different opportunities to provide feedback throughout. And we really hope that you'll leverage those so that we can identify additional things that we may not have thought of through this Research Coordinating Center. So we're really happy to have feedback as well from the community joining us. So
yeah,
thanks.
Before we move on, that was a great answer. Thanks, Amruta. Before we move on, just encourage Edison and any other folks who are coming from the perspective of the Global South or LMICs more generally to reach out to us and provide us with input as to how we can be most helpful as we develop the CAFE functions that Amruta just described, because we really want to target it to the needs that have been identified by you all. So I think we'll move on now. I'm not sure who's going to be leading the slides at this point.
Gaurab, if you still have the slides handy, it would be great if you could just click me through these transition slides. So thanks, Pat and Gaurab. That was an awesome first session. Always learned so much from you guys. So as Gaurab mentioned, we need to do kind of both the storytelling and on the ground work. We also need to do the data analysis and quantitative work to inform climate and health action. So now for the second half of this educational session, we're really going to turn to more of the data analysis side and give an introduction to approaches that are commonly used in quantitative climate and health research. So a lot of the empirical quantitative work on climate and health is, I think, as Pat mentioned, it's more focused on quantifying the magnitude of effects of climate exposures on health. And so, of course, to do this, we have to rely on historic data. So we need to study historic climate exposures to understand how those impacted health. And then that information is critical to inform estimates of how future climate change might impact health. So while a lot more work is needed to fully understand the full scope of climate and health impacts, there's already been a good bit of research done in this space. And in particular, there's a relatively large body of research showing how air pollution of various types is associated with damage to almost all bodily systems. And so this is something that's been studied for the past 30, 40 years really intensively and is really well established. There is a smaller but quickly growing number of papers, a smaller body of research that is starting to show the broad impacts of heat and heat waves, hurricanes and floods, and wildfire smoke on health. Next slide, please, Gaurab. So what kind of data are typically used to conduct these historic studies to quantify the magnitude of effects of climate exposures on health? So modern satellite data has really revolutionized our ability to measure certain climate exposures at a global scale. As was mentioned in the Q&A just a second ago, this set of exposures that's routinely measured is relatively narrow. There are still many more things that we need to figure out how to monitor and measure. But satellite data has really helped us take a huge step forward in being able to get reasonably good quality measurements of a lot of different climate exposures globally. And so we're lucky that today a lot of these satellite data products have been translated into high space-time resolution gridded exposure data for some sort of commonly considered climate exposures, as shown here. Another nice thing about these climate exposure data is that the community has been quite good about making them publicly available. And so we've listed here for just 4 common exposures studied in the climate and health space. We've listed some of the publicly available exposure data sets that we're aware of. I'm sure there's more, and the number is constantly growing. And these exposure data can then be linked with a wide variety of health data sources, including administrative data, cohort study data, things like that, to do these historic climate epidemiology studies. Next slide, please, Gaurab. So for the remainder of this session, we're going to, again, be focused on these more quantitative methods for climate and health studies. And we're going to be demonstrating concepts very practically by showing you data examples. And we're going to be focused on a single kind of running example across the rest of the session, where we're going to be looking at the study of the impacts of wildfire attributable fine particulate matter, or PM2.5, on a synthetic mortality data set for California. So I'll explain more about what that means in a second. First, in this study that we're going to be using for motivation, we've pulled in real county level estimates of daily wildfire attributable fine particulate matter concentrations. So this is an example of one of those publicly available exposure data sets that I mentioned for about a 5-year period. So we have these daily for this 5-year period. If you're interested in this, you can download the data from the link given here. Unfortunately, on the health data side, as you're probably aware, it's harder to make data publicly available for privacy reasons. And so for the demo today, we're going to be relying on synthetic data, which is data that we've generated to look like real health data, but that aren't real, so that we can share them with you and you can reproduce these examples on your own if you want to. So we've paired this real wildfire particulate matter concentration data with our synthetic county level daily mortality counts for the same time period of about 5 years. You can also access this synthetic data set and the code that was used to generate it from the link given here. This is the example data set that we're going to be working with for the remainder of this session, this sort of wildfire PM exposure data paired with synthetic fake generated daily mortality counts. And the first thing that we're going to do with this data set to demonstrate how you might use a data set like this in real research is to do some exploratory data analysis and demonstrate effective data visualization strategies for this type of spatiotemporal data. And for that piece, I'm going to turn it over to Heather Clifford, who is going to, I believe, now take over the screen share, Gaurab, if you don't mind. to show us how to visualize data. Thanks, Heather.
Yeah, thank you so much. Let me just... Got it?
Yeah.
Great. Good afternoon, everyone. My name is Heather Clifford. I'm a data scientist at the Institute for Global Sustainability. Today, for my demo, we'll be learning about data visualization and science communication. I'll be exploring how we can effectively convey complex information using an online data visualization tool. It's called Flourish. I'm going to give some examples how I utilize Flourish in my day-to-day work for a science communication project called Visualizing Energy. And then I'm going to give a demo on creating a Flourish chloropleth visualization using wildfire PM2.5 dataset from Childs et al. 2022, which Rachel just discussed. So effective science communication is crucial for sharing insights, discoveries, and complex information with diverse audiences. It bridges the gap between researchers and the public, making scientific knowledge more accessible and engaging. I added some best practices that I utilize for my research project for effective science communication, which is one, to know your audience. So tailoring your message to your audience's level of understanding and keeping it interesting at the same time. Simplicity is key. So keeping your visualizations clear, concise, and easy to interpret, and also helping to guide your users to a conclusion. Tell a story. So use your story to tell a compelling narrative that captivates your audience. Again, keeping it really interesting. And then leveraging Flourish's interactive features to engage your audience. So one thing that Flourish has is it is interactive, which allows you to engage more with the visualization than, say, a static visualization. However, Flourish does have some limitations because it is not code-based. So you kind of have to leverage between the interactive ability and then also the simplicity versus having to kind of figure out how to edit how you want to visualize your data. So I'm going to go through my project right now. It's called Visualizing Energy, visualizingenergy.org. We build data stories to guide an equitable energy transition. We've built this about a year ago. So we've produced about 90 data stories and have about 350 data visualizations on the site right now. We focus on energy justice, well-being, history, sources, and we also have some on health, which I will show a few examples. So these are some of the types of data visualizations and data story titles that we have. I'm going to go through what we have for a data story related to health. This one is titled, Where Are People Dying Due to Indoor Air Pollution from Cooking Fuels? So this project was founded by Dr. Cutler Cleveland at Basu University, and I am also a co-lead with him on this project. So here is an example of a Flourish visualization that we're using within this data story. So as you can see here, this has a header, a caption, a legend, some information down here on the source, and also a logo. And then it also allows us to have some interactive ability on the visualization. So this is a chloropleth map showing deaths caused by indoor air pollution from the use of solid fuels in 2019. And just kind of showing the information that is held within each of these pop-ups that comes up. Also show some other examples. So this is a dot plot for the share of deaths caused by indoor pollution by income class in 2019. And so it's colored by continent, but what's great about this is you can isolate by continent as well. So you can kind of explore more into this data rather than, it's a little bit clustered right now, but if you interact with it, you can kind of get a different message and you can learn a little bit more. And then also it has pop-ups, so it's interactive. So it has a lot more information than, say, a static visualization would have. This is also done using an embed into the HTML. So on our site, we have the data available, metadata, an image, a PNG, and I'll discuss about how you can extract these images once we get through the demo. And then also we have the embed available. The embed is also available on the Flourish website as well. I'm just going to go into this. This visualization does not want to show up. Great. Okay, I'll go to another one. So this is the health impacts from oil and gas production in the United States. This is our translation from a scientific publication that came out in 2023. And this is a choropleth map of US counties of mortality due to air pollution from oil and gas production in 2016. So just kind of showing a different choropleth map. And then the types of information that you're able to show within these pop-ups. And then also kind of using this visualization as an example for color. And so using this legend up here, we can kind of be able to show which counties have the highest mortality, and your eye kind of focuses in on these really dark colors. So again, really just helping to guide the user's eyes to what you want to show them and for them to be able to create conclusions based on a visualization. So now I'm going to go to the Flourish site. So this is flourish.studio. This is a free to sign up software. So you go up here, click sign up, you just give them your email, and then it creates an account for you. There is a paid version. It is pretty pricey, but a lot of the visualizations that they have available on the site are free. There's just a lot more flexibility on the back end, and then there's some visualizations that are not available in the free version. So just in general, Flourish is an intuitive and user-friendly data visualization platform. Allows us to create interactive visualizations without any coding or design skills. It does have limitations, so it has less flexibility than coding. So this causes us to have to simplify it a little bit further. So I'm going to sign in here. So this is the back end, how it looks. I have like over 350 visualizations in here that me and my students have produced for the website. So this is just how it looks inside the folders. If I go inside one of these folders, it just shows all the visualizations that have been produced under these IDs. And then you can sort and show different bits of these for the visualizations. And up here, you can create a story. I'm not going to go discuss a story, but it's pretty much a layered visualization. And then over here, you click new visualization in order to create a new visualization, and you can choose between a lot of different templates. So as I mentioned, Flourish has a lot of free templates available. If it's shaded over, that means that it's not a part of the free version, and I'll show that in a second, or you can just click on premium, and these ones are not available, so it's really a minimal amount. So here is some examples of data visualizations that are available. This is line, bar, and pie charts. And so here's a surplus deficit area chart that we had actually shown earlier in during the presentation. We have an area charts, grid of column charts. And what's really great about Flourish is, say if I click on this example, I'll go through all of this interface in a second. But if I click on data, they have data formatted exactly how they would like for it to be put in already inside of each visualization. So no matter what type of format you want to be able to put it in, you can kind of see what the format they would like, take your data, manipulate it, edit it, put it into this format prior to putting into Flourish. And then all you have to do is utilize this section on the right and highlight what columns you would like to use. So I'm going to go through all of this in just a second. I'm just going to show some more of the visualizations that they have available. So they have projection maps. So these are based on shapefiles. These ones already have shapefiles available inside of them in their in the data set, but you can also start with a blank and upload your own shapefiles. They have scatter plots, box plots, bubble charts. They have actually included a lot more data visualizations since I started using it over a year ago, because Canva purchased Flourish, I believe, last February. So they've been continuously upgrading it through time. So they, box plots, violin plots, different types of scatter plots, a lot of different options, a lot of different ways that you can format these plots as well. 3D maps, bar chart races, we use these a lot. Hierarchy plots, they've actually, this one just popped up. This one was not there this morning, so that's kind of fun that they're adding more visualizations in here. So tree maps and sunbursts. So again, like a lot of different options, really fun to explore. Definitely recommend going to the website and checking out the different types of data visualizations they have. So the heat maps. Yeah. So I'm going to go in and show the format of a US county map for a chloropleth map. So in here, we have the data visualization itself, and this is how you edit it. Up here, you can change the sizing of the preview. Here, you can click between preview and data. So this data tab is where all this data is contained. I can go up here and name it map. So we have the regions tab, a regions geometry tab, a points tab, and a lines tab. We're going to not use the lines tab today, and the points are based on Latin lon, but we're also not going to use that. So I'm actually just going to clear this for right now. And so now you can see that those dots on the plot were removed. I'm going to go back into data and just kind of explain what's happening here. So inside of regions, we have the county FIPS, which is being used as the ID for the geometry. So if I go in here, they have little question marks next to the columns to visualize, and they have an explanation for exactly what you're supposed to be putting in here. And as they mentioned, it's an ID to match values in the region's geometry. So I'm going to go back into here, and I have the geometry layer here. So if I click on this, it's polygons, a shape file already imported in here, and then they have the county FIPS, and so it's already imported that this should be column A and this should be column E to match. And then if I go back to regions, again, the county FIPS is the ID. So then you kind of go into these other columns for the name. So that's the name that appears in the pop-up. A label, so that's if you want a label to be shown on the map. And then the color by, so here they're coloring by a value, but the value is based on the state name. So as you can see in this preview down here, each of these states are colored something different. And then you can also group them, and this one is just drawing borders around the groups of regions, so state borders around counties. And so I'm going to use this information that we have here, and I am going to start with a blank map and create a map of California using wildfire PM 2.5. So I'm going to go back in here. I'm going to click on new visualization. I'm going to go to this projection map that's blank. I'm just going to name it. Yeah. And I'm going to go into data. And so I'm going to start with uploading information here. So I already have the data formatted into the way that the Flourish had shown in that previous example. So I use code to kind of take it from a daily PM 2.5 and then aggregated it into exactly what the format that I needed. And then I also have the geometry layer in here as well. So what I'm going to do is I'm just going to go in here, add the ID as B, and then I'm actually just going to copy these and add these into regions geometry. So I'm going to put the geometry files in here. And then I will add in geometry as column B, and then the ID as A. And then as you can kind of see down here, this example just popped up for California, but it's not colored in yet. So I'm going to go back to regions. And as you can kind of see, this looks like Excel. The only formatting that you can really do here is sorting, removing, inserting a column left and right. Then you can also change the data type between number, date, and text, which I do not need to do. So what I'm going to do here is I'm going to name it by the county. So I'm going to name it with column E. And then I'm just going to start with adding column V as the color by. So that's going to color by PM 2.5, the summed up PM 2.5 total for 2020. And then I could also add a group or info for pop-ups, but I'm not going to do that. And so I'm going to go to preview and change this just so we can all see the total of California. Okay, so now we're starting with a chloropleth map of California. we have a legend up here, we have a search tab right here, and then it's in the color blue. And so I want to format this to make it a little bit nicer. So I'm going to change the projection here. So this tab under projection, you can edit it. I can say world, obviously, we don't want that. We're going to do auto, so it just goes to the bounds of the shapefiles given. Next, we're going to go into regions layer. And so this is enabled. So fill right here, this is if there was any blank values inside of the map. And we don't have one, so don't need to worry about that. Outlines are on, but I'm going to change this to black to make it a little bit better outlined and then increase the width a little bit. So there's a lot of ways that you can format the visualization itself. It's very straightforward. There's just a lot of different things that you can do, which can be a little bit overwhelming. So we can change the colors of the regions layer between sequential and diverging. I don't think that's really helpful for the user, so I'm going to keep it sequential. You can also bin them, and so you can have a fixed width, change the number of bins. I'm just going to keep it as linear, and then I'm going to change the color scale as well. Well, they have a bunch of different color scales that you can choose from. I'm going to go with yellow, orange, and red. And then for the domain, it's for the legend right here. It's between 408 and 6000. I'm actually going to change that to make it a little bit nicer looking. So it's rounded up and down. And again, with the missing data, you can use a pattern, you can use the fill. I'm just going to keep that same because there is no missing data here. And then I'm going to remove 2 of the decimal places because we don't really need to use decimals here. We can round that up. And then I'm going to add units for a suffix right here. So number styling, you can add prefix or suffix. I'm going to add a suffix so that there is, I'm going to actually have space as well, so that there is units to the values that are being shown. And then I'm going to add a shadow because it looks fun. All right, so a bunch of different, again, like a bunch of different options for formatting. Points layer, we disabled that because there's nothing going on there. Globe and graticule layers, we're not going to use that tab. Under controls, so I'm going to show an example of how we would use this control type. So if I go into data, I want to show between 2006 and 2020. So I want to be able to show different years. I'm going to start with H through V. And so I'm able to show a number of different columns. So at the top here, now it's reflecting 2006 to 2020. However, this is not changing now, so I need to go back up to regions layer. Make the domain auto, and then I'm going to base the default scale on current column because clearly there's a lot in 2020 in comparison with these other years. So if we want to kind of just look at these individually, I'm going to do that. And then I'm going to go back into controls. And so if you can see here, there's a drop down, there's buttons, or there is a player. So I'm going to keep the player because we're going through time. And so you can kind of press play and you can let the player go through and let the user kind of explore Wildfire PM 2.5 over time. And then I'm going to keep everything else the same for this styling, but there's a lot of options here. Pop-up and panels. So this is the pop-up that you're seeing right here for this county. I'm just going to edit this. You can customize the content inside of the header and also add information into this info for pop-up. So if you have an additional column that has more information, you can add that here. But I am just going to customize the style of it. So I'm just going to customize the header, and then I'm going to change the label weight. So that just makes it stand out a little bit more on top of the visualization itself. But again, like a lot of different ways that you can edit these. Great. So now I'm going to go, I don't think we have to, you can change what the legend is, change the text. But you can also go into layout and you can change the fonts. So I'm going to change the font to Roboto, and then you can change the color of the background, etc. A lot of different ways you can change how the visualization itself looks. I'm going to add a header. And I'm going to make it a little bit bigger. And then you can also add a caption below as well. And then I'm going to add a footer down here with a source. That will pop up down here. And then if I just show a little bit more of this, then we have a finalized visualization for the annual total PM2.5 data in California counties from 2006 to 2020. Excuse me, 2020. So this is just an example of how we can show a visualization and how quick and easy it is if you have the data in the correct format or to create such a visualization. So I'm going to add also a link to my Flourish Studio, which has, as I mentioned, like over 400 data visualizations, has a bunch of different examples. Visualizing energy also has a lot of different examples for a bunch of different types of data visualizations. Yeah, so I'll add those links in there as well. I have a few other visualizations that I would like to show. So here I create a line plot using total wildfire PM2.5 data in California counties for the top 5 counties with the highest total PM2.5 from the years 2006 to 2020. So this is a line plot. And as you see here, I added the units. We have a y-axis label. And what's really great about Flourish is that when you add a line chart, you also have the availability to scroll through different chart types underneath these examples and just click it, and it will automatically shift to these different types of visualizations. So you can kind of check out, which data visualization you would like to look at. And again, there's no code. You just have to make sure that the data is in the correct format that Flourish is requesting. This one's a bit different from the regions layer. There is only one data tab, and then they have a date or labels and time, and then values, which look like this. Another great thing about Flourish is that you can add annotations and highlights. And so here on the x-axis, I include a line just for an example to show that I can highlight a certain time period to show that there are increased wildfires during this year. And then I can also do the same, and I can highlight different year time periods to show, just so I can help guide the user's eyes to a certain point on the data visualization itself as well. Here's another example of a data visualization that I made. So this is, if I go into data, this is how the data is formatted for this one. But what I want to show is that I am using a row filter. So I use this column to create a user-facing row control. This is kind of similar to the player that I had shown for the different years, just a different data visualization format. And so I'm in the controls and filter section, and I can go on down here and I can have a drop down, I can have buttons, or I can have a player. For this one, I like the buttons. And so you can click through and you can look at different daily wildfire PM2.5 data. And again, I added the color here. I changed the color of the line as well. So there's a lot of different ways that you can edit this and edit how the X and Y axes are formatted. And then I'm just going to go quickly show another example of this, but this is number of wildfire data days between 2006 and 2020. Again, for these 5 different counties that you can click through. This is the same using the rows filter that I just shown in the inside of here. And then using this exact same data set, I'm going to input for the charts grid. I can just go over here. So I'm going to go into data here. I changed. So if I go in here and I just, so it goes from the preview down here from the visualization that I just showed. I'm going to change it to the charts grid. And then this creates a grid of charts. I also have to go up here and, select grid of charts. And then this is the data visualization that we can get out of it. So we can see them all at the same time. And so the last thing I am going to go through is exporting. So you can download the image here. You can download it as a PNG. I recommend hitting the 2x and it will download the visualization as you see it here. And then you can also publish it to share and embed. It's also, you can make it so others can duplicate it. So if you publish it, they give you a link to the visualization that's public. They give you an embed. And I'm going to click on this here. So here is the link. So this is a public link now to this data visualization. I can duplicate it and edit it. It also makes the data available. So if you don't want your data to be available, I don't recommend making it so that you can duplicate it. Here's the embed code. You can also share it. Personally, with the website that I have, I screenshot because I find that the PNG that you download from the website or from the Flourish website is not super high quality. So I take a screenshot of the image that I create here, and I feel like it's a little bit more high quality than what they're giving you. And then I also do screen recordings in order to create GIFs for the ones that have animations as well. So why Flourish? I found it to be straightforward to edit and format. There is no coding necessary. They have a lot of helpful examples, blogs, and templates on their website. It's really easy to duplicate and create new visualizations with the same formatting. It's good for students. So for my project, we started out, when I joined, we were using Tableau, and a lot of the students had trouble. It was like every single meeting we had, they were having a lot of technical issues with Tableau. It wasn't easy to duplicate the visualizations. There was a lot of issues, and this, we're able to kind of crank out a lot of visualizations for our platform using Flourish. And then also because of limitations, data sets and visualizations must be simplified in order for it to be, for users to understand kind of what we're trying to convey through the visualization. And that is all from me. Thank you so much.
Thank you, Heather. That was awesome. I learned a ton. I think there was just, last time I looked, there was maybe 1 or 2 questions in the chat. I think one of them was about the number of visualizations that you can use under the free license. I don't know if you know that off the top of your head, but if you have a sense of if it's like a lot or a little.
It's a lot. I mean, I'm probably at like over 500 right now on my account, and there's never been a problem. So I think it's unlimited. I think it's just if you go into the premium version, you'll just see the types of visualizations that you can't use. Those are like the main limitations. And then there's a lot of backend. They have an SDK as well, where you're kind of able to edit the visualizations a little bit more. So that kind of seems like to be the major limitations. But we've been using the free Flourish version for a year. And the only part that we really wish we had was the scrolly telling in the paid version, if you know what that is. It's a really cool feature, and we've been kind of wanting to get it. So, but it's a pretty expensive software to pay for. So, yeah.
So you use the free version?
We use a free version, yeah.
Okay, great.
Yep.
Good to know. Okay, thanks, Heather. I think, Heather, I don't know if you have a few minutes to stay on if anybody has any more questions in the chat. That would be great. If not, that's okay. Thank you so much. That was really awesome. Okay, now I am going to try to share screen. So hopefully now you're seeing my desktop with the slides. Okay. So now let's see if I can get these into full screen. Okay, hi everybody. So you've already seen a little bit of me, but I didn't formally introduce myself. I'm Rachel Nethery. I am a biostatistician by training, working in the biostats department at Harvard School of Public Health. Obviously, with a particular interest in statistical methods for climate and health research. And I am the co-lead of the capacity building function of CAFE with Pat Kinney, who you heard from earlier. And I'm going to be talking a little bit about commonly used study designs and statistical methods for climate and health research, along with my colleague, Dr. Amruta Nori-Sarma, who's going to take over here and there for me as we move through the slides. So for this session on statistical methods and study design, unfortunately, we can't really start from zero and build up from nothing. We kind of, given the very limited time that we have here, in order to get to the climate and health relevant methods, we kind of need to assume some background with basic statistical methods and inference. So for this session, we're going to assume that you have some a priori familiarity with basic statistical inference quantities like p-values, standard errors, confidence intervals, that you know what those are already. and maybe a little bit about where they come from, and the concepts underlying them. We're also going to assume that you have some general familiarity with linear regression modeling techniques. In particular, it would be good if you've seen linear models before. In this session, we're going to be relying specifically on Poisson regression models, which are commonly used in climate and health research, but I realize are a little bit more unusual in a lot of other research domains. So it's okay if you haven't specifically seen Poisson regression models before. But I think at times you may be a little lost if you haven't seen any linear models before. So hopefully you know a little bit of linear models, and have some basic idea of how to interpret model output from a linear model. And finally, we are going to be using R in RStudio just a little bit throughout this session. So we are going to assume, in order to sort of get the full effect of those pieces, we're going to assume that you've seen R before, you know some basic commands and object types, how to import and look at data. And maybe as a bonus, even how to fit regression models. If you're not familiar with R, or you're a user of another statistical software, you won't be totally lost in this session. There are just pieces where things might not be totally clear to you. And so if you are new to any of these concepts, we are linking here some free materials that you can use to get the background, and then potentially come back and be able to get more out of this session from the video recording. So there are a few links here for sort of general statistical inference, linear models, and R in this open intro stats book that's freely available. And then specifically for Poisson regression, which again is a little bit more of a topic that's more specific to environmental and climate health research, we would recommend this Poisson regression chapter of the Beyond Multiple Linear Regression book, which is also freely available online. So first, let's talk a little bit about commonly used study designs in climate and health research. So ubiquitous feature of climate and health studies, particularly climate and health studies that want to quantify the magnitude of the effect of a climate exposure on a health outcome, is that they almost always rely on observational data. So experiments of the type that are used in like, for instance, clinical trials, are usually unethical when we're thinking about effects of climate or environmental exposures on health, because, for instance, we already have some idea that heat or wildfire smoke are bad for your health, and so it wouldn't be ethical to randomize some people to receive those exposures and other people not to receive them in order to study their and quantify their effects. So most climate and health studies are then sort of stuck with just using observational data that's going to rely on natural variability in exposures and outcomes to try to disentangle their associations. So the purpose of the purpose of climate and health studies can either be descriptive or what we'll call associational or causal. So descriptive studies would be looking to describe a climate and or health process. So purely to describe it rather than to test a particular hypothesis or to assess associations between variables. And so an example of a recent descriptive study in the climate and health space was the one that produced this figure here, which was describing spatial patterns in California in extreme heat and wildfire smoke co-occurrence. And so what you're seeing in these maps, similar to the ones Heather was showing you how to produce earlier, is sort of the frequency of heat and smoke co-occurrence. That's what HSC stands for, across communities in California, with lighter colors indicating higher, more frequent heat and wildfire smoke co-exposure. And so this study and a lot of other studies in the descriptive climate and health study space are often are focused on kind of identifying communities that are very highly or disproportionately exposed to climate exposures. And also potentially communities that, because of other factors, are particularly vulnerable to the health impacts of climate exposures. So moving forward, while descriptive studies are extremely important, we're going to be focused mostly on methods for conducting associational or causal studies. So that means we're going to focus on study designs and methods for studies that seek to assess associations between a climate exposure and a health outcome. And you'll note that I said assess associations between an exposure and an outcome, and not assess the effect of a climate exposure on a health outcome. So why did I say it that way? So usually, in fact, when we're conducting these kind of studies, what we actually do want in our hearts is to be able to ultimately conclude that our exposure that we're investigating does or does not cause a particular health outcome. But there are some complications to making these conclusions in most climate and health studies. And these complications mainly arise from that observational study design that I was mentioning on the previous slide. So observational study designs have this threat that a phenomenon called confounding can bias their results. So what is confounding? Confounding is when your exposure of interest is systematically associated with other factors that also affect health. And so in this setting, where we have confounding, if we just quantify effects by using simple, unadjusted measures of association between the exposure and the health outcome, those effect estimates will be biased because they absorb some of the effects of these other factors that are related to both exposure and outcome. So in these settings where we have confounding, which is typically in observational study designs, we have to take special care to try to disentangle the health effects of our exposure of interest from the effects of these other confounding factors. So an example actually can be drawn from the data that we saw in the previous slide, this heat and smoke co-exposure study. So we know that wildfires tend to co-occur with heat and drought. And so if we're wanting to estimate the effects of, say, wildfire smoke on health, then we have to disentangle those effects of wildfire. Oh, was there a question? Oh, sorry, I thought I heard somebody ask something. So we want to disentangle the effects of wildfire smoke. So we need to disentangle, the effects of wildfire smoke from the effects of the health effects of heat and drought that are often happening concurrently with a wildfire. And usually this sort of disentangling from a statistical perspective happens via regression modeling techniques, although you'll see later that there are some other techniques that can be used to try to do this. But let's say that you're clever and you realize that heat and drought are possible confounding factors in your study of the effects of wildfires on health. And so you use some statistical modeling to adjust for heat and drought exposures to try to disentangle the effects of wildfire smoke. The problem is that with observational study designs, we can never guarantee that there aren't other confounding factors lurking out there that we haven't accounted for that could be biasing our effect estimates. So even if you're thorough and even if you try to find all these confounding factors and adjust for them in observational designs, we can never guarantee that there aren't more out there that we haven't accounted for and that could be biasing things. So any associations that we see in observational studies always come with this kind of caveat that they might not actually represent causal effects due to potential unaccounted for confounding. And so in this session, we'll probably sometimes use the word association and maybe sometimes use the word effect, maybe use them interchangeably, but just note that there's this caveat implicit in the background that we're working in observational studies and And there could be additional sources of bias lurking in the background. Also, in associational studies of climate exposures and health outcomes, we could be interested in either short or long-term exposures, so short or long-term climate exposures, and those either short or long-term exposures could have either short or long-term effects on health. And so we need to decide a priori which of these things that we're interested in, because they require studies of short and long-term effects require different sets of study designs and methods. And so for this session, we're going to be mainly focused on methods for studying the effects of short-term exposures on acute, sort of immediate health outcomes. And the reason that we're focused on this is that that's where the majority of previous climate and health research work has been done, is on short-term exposures and short-term health outcomes. And now I'm going to pass it to Amruta to talk to you about excess event studies.
Thank you so much, Rachel, for starting us off. So yeah, I'm going to dive into a little bit of detail on the different types of study designs and methods that we use for short-term associational studies. We're going to be going into a lot more detail in each of these different types of study designs a little bit later in this session. But I just wanted to also highlight that in the chat earlier, Rachel did share the GitHub page where you can access the R Markdown file to follow along with some of the analyses that we'll be conducting over the course of the next few minutes. So first, I want to talk a little bit about excess event studies. These are studies where we can estimate the number of excess events, excess health events, or excess morbidities or mortalities that are caused by a particular discrete climate exposure. Usually this is done across a very large geographic area, and it's done on an event-by-event basis. And I'll talk a little bit more in detail about the relative pros and cons of each of these different types of study designs in a few slides as well. Now, by comparison, if we have multiple events that are occurring over time, we can utilize time series methods. So time series studies are used to estimate increases in health risks that are due to either discrete or continuous recurring climate exposures. And in order to do this, we leverage data that's collected across many regular time intervals. So you might think of daily temperature and daily morbidity or mortality outcomes. You might think of a wildfire season in which multiple wildfires are occurring. And one of the nice features of time series studies is that the effects can be aggregated across time for one location or for multiple locations. So we'll talk about single site time series methods and multiple site time series methods as well. Additionally, one feature of time series studies that we want to highlight is that you can identify the concurrent effects of exposure on outcome, or you can also look at the lagged or delayed effects of exposure. So for example, what is today's temperature impact on today's mortality events? Or what is today's temperature impact on tomorrow's or subsequent days' mortality events? Under certain conditions, a time series study can give equivalent results to other types of commonly used quote unquote causal inference methodologies, including things like the case crossover study design, which we're not going to go into in more detail right now, but we certainly can share resources for how to set up a case crossover study design subsequently in our after our session. Next slide, please. So excess event studies are the first study design that I'm going to describe in more detail. The objective of an excess event study is to estimate the number of excess health events that are caused by a climate exposure. This is in excess of what would have been expected under a business as usual scenario. And so the example that we've provided here is from a study that I was a co-author on with collaborators based in India, looking at a period of extreme heat that occurred in 2010 in May. You can see the temperatures are illustrated in the the solid lines on the graph, with the red line showing the daily temperatures in May of 2010, and the blue line showing the daily temperatures average for the same period in 2009 and 2011. And what we observed during that heatwave period is that there was an increase in the daily number of mortalities that were occurring during that, concurrent with that same heatwave period. So that's represented in the red histogram in 2010 compared with the blue average daily death counts from 2009 2011, the same period. And leveraging this excess event methodology, what we were able to do is illustrate that approximately 800 mortalities occurred during the 2010 heatwave period that we wouldn't have anticipated occurring in the same period in 2009 or 2011, because in 2009 and 2011, that heatwave had not occurred. So what we were able to use this study for was a significant and discrete climate event, which was the May 2010 heat wave, occurring across a large geographic region, which was the entire city of Ahmedabad in the northwestern state of Gujarat in India. Next slide, please. So what is the approach that we can use for some of these excess event studies? What we want to do is we want to define the exposure period, which can be challenging because, giving the previous example, what is it that constitutes a heat wave? There are a lot of different definitions for what constitutes a heat wave. So we want to identify the exposure of interest, which could be an extreme heat event, it could be a wildfire event, it could be a strong storm. And then we want to try and select a control period that can be used to inform us what the number of events are that would have been expected under a business as usual scenario, kind of setting up a counterfactual of what would the numbers of mortalities or numbers of health outcomes have been on those days had this exposure period of interest not occurred. And then the way that we compute the excess number of events is that we compare during and after the climate exposure in the exposed area as A, with the control period of the same length in the same area in a different time period as B. And then the number of excess events is simply the subtraction of the control period number of events from the case or climate exposure period of events A. And then we can also estimate the rate ratio as the ratio of A to B. Next slide, please. So one of the challenges of excess event studies is the selection of this control period or this counterfactual. So when we're understanding the setup of the excess event study, we estimate that these studies are adjusting for confounding through the selection of the control period that is believed to be relatively similar to the exposure so the exposure period in all ways except for the fact that that climate exposure had occurred. So in the previous example, we selected the previous year and the following year to estimate what the mortality impact we would have anticipated under business as usual to be, because there might be changes in the temperature in this region occurring from May to June when there's maybe the onset of the monsoon season, which impacts both temperature and humidity, or there may be other characteristics of an earlier month that would create a scenario in which the control period in the same year, but in a previous month, would not be as similar as we would like to the case period or the extreme heat period. And so that's why we chose the same month of May in the year 2009 and 2011 as the comparison for what was happening in 2010. So it's really important to make sure that when you're setting up your excess event study, you're selecting this reference period that would be as similar as possible on all of the different potential confounders in order to make sure that you're identifying the true effect of the exposure of interest. So for example, if studying excess deaths due to a hurricane, you would want to make sure that other meteorological factors like temperature are comparable during the exposure period when the hurricane was happening and your control period. You should also be aware that there are potential time trends that are happening even within a shorter period of time. One of the things that we do see is that the numbers of morbidities and mortalities that occur on weekends versus weekdays have general fluctuations that can be observable in long-term trends. So comparing a Monday or a Tuesday, the numbers of mortalities to what was happening over the weekend before that may not be a good selection of a reference period. So some of the common choices that we can use under this study design are the same time period from another year as what we did in the case of the India heatwave study. We could also look at the average from the same time period in multiple other years. One of the things that we do want to note, though, from this choice is that there may be long-term trends in health outcomes. Say, for example, if the number of people living in a city grew exponentially between 1 year and a subsequent year, that might lead to additional issues in some of the baseline population at risk between years that would lead to incorrect inferences if you chose periods from different years as reference points for the year of interest in your study. Next slide, please. So I want to talk through a little list of the pros and cons of this excess event study methodology. So I think that there are actually some really great features that you can leverage from this type of study design. So we're relying here on aggregate health data, which helps to alleviate some of the potential concerns around patient confidentiality and protection of patients. It's also relatively quite easy to understand and explain and interpret, and it's also very easy to set up these study designs, as I'll walk you through in a real world example in a couple of minutes. And in this study design, because we're careful in the selection of the referent period for our case days of interest, we are, in theory, adjusting for potential confounding by design, rather than through developing a modeling structure that we believe will help to adjust for potential confounders on our behalf. However, there are some downsides to this type of study design. The first is that it requires an exposure that is discrete, that is temporally very well defined, and that is spatially constant across the study area of interest. One of the other things that I want to note is, given all of the characteristics, including short-term time trends, long-term time trends, potential differences in the exposures that might be of interest other than your main exposure, it may be difficult to find an adequate control period. So this is something that requires a lot of consideration when you're trying to draw inferences on the excess risk of different events associated with these exposures of interest. Next slide, please. So I think we're actually going to move over to Excel. Right.
Can you see it?
Yes.
Okay.
So I want to share with you the example that we've pulled out here. One of the things that we mentioned earlier during Heather's session is that we were going to be leveraging the wildfire-specific PM2.5 data for California. So this is a time series plot of the wildfire-specific PM2.5, and then, the days of the wildfire season that are occurring. And then this is the time series plot of actually the mortality count by day. And this is synthetic mortality data that we've generated for this example in order to facilitate the implementation of these different study designs. So it's entirely synthetic data. None of this is representative of any actual mortalities that have occurred in these counties. But what the features of the mortality data are is that we're able to look at, on a daily basis, what are the numbers of aggregate mortalities that are occurring on a county by county level across the entire state of California. So here we've pulled out a single county, which is Los Angeles County. And in the period in approximately June to mid-July of 2017, there was a particularly extreme wildfire event, which is highlighted in the center panel in gray. And so for our excess event study, we're looking at the comparison of 2017 with the previous year, 2016, in the same time frame, also highlighted in gray in the top panel, and then the same period in 2018, highlighted in the bottom panel in gray. And so, in effect, what we're looking at is where the numbers of mortalities across this time period in 2017, shown in the gray area of the figure, comparable in 2017 compared to the average of the numbers of daily mortalities that were occurring in 2016 and 2018. And if we see excess events during 2017, can we associate that with increases in the air pollution exposure, the fine particulate matter exposure that people experienced as a result of the wildfire event that was occurring simultaneously? So now we'll go back over to the Excel sheet. And so what we've done here is we've pulled out in columns B through G in the Excel spreadsheet, we have one column for exposure, that is the estimate of daily wildfire-specific PM 2.5. For 2016 is in column B, 2017 is in column D, and 2018 is in column F. Those are all of our exposure estimates. And then for each day, we've also pulled out the corresponding synthetic mortality data. So in 2016, that's shown in column C, 2017, that's shown in column E, and 2018, that's shown in column G. And so in order to facilitate the comparison between 2017 and the previous year, 2016, and the following year, 2018, we've estimated the average of daily wildfire-specific PM 2.5 for the period in 2016 and 2018, which we're using as our reference period. And that's shown in column J. And then similarly, we've estimated the average number of daily mortalities in the 2016 and 2018 reference period, and that's shown in column K. And in order to handle any potential fluctuations in the short term in the numbers of mortalities that are occurring within these control periods, another estimation method that we can use is a smoothed average of both PM 2.5 and mortality. So we've chosen here to do a 1-week smoothing average. So this represents the average of the previous 7 days of both PM 2.5 and mortality. So that's shown in columns L and column N. And so what we have here is a very simple overview from the 1st of June until about the 20th of June in the bottom of our table of the daily estimate of wildfire-specific PM 2.5 averaged for the control or reference period of 2016 and 2018. And now we can simply do a comparison of those averages with our 2017 wildfire-specific PM 2.5 and mortality data shown in columns D and E. And the way that we've done that is through a very simple graphical visualization shown in sheet 2. And so what you can see here, very similar to the example that I shared earlier, is that in the plot on the left, we're showing the excess risk of mortality and the wildfire-specific PM 2.5 plotted on the same figure. And what we find is that during the time period in 2017, we can see the wildfire event, which is of interest for us, which starts around the 3rd of July and continues towards the middle of July as well. And we see the numbers of daily mortalities in 2017 highlighted in orange. And then the comparison period, the wildfire-specific PM 2.5 exposure is shown in the gray curve. And the same period, the comparison period mortalities are shown in the blue figure, the blue histogram figure. And then in order to estimate the excess attributable mortality, we do the comparison of the average daily mortalities for 2017 compared with the same period in 2016 and 2018, which is shown in rows 16 and 17 here. And we estimate that approximately 4 additional deaths were attributable to that wildfire period that occurred in June of 2017. And the attributable fraction, which is the comparison of the excess mortality to the actual numbers of mortalities that occurred during that period on a daily basis. And what we see is that there's approximately a 1% increase in the attributable fraction. And then, so this represents the comparison with the very straightforward average. It's 2016 mortalities plus 2018 mortalities divided by 2. And I mentioned that we may want to look at a smoothed estimate of the numbers of mortalities. So we can see that in the figure here to the right. This is the 1-week moving average of daily wildfire-specific PM 2.5 and daily mortalities. So what we can see is that in 2017, we have the entire record of daily mortalities because we haven't done any moving averages. But our smoothed average mortalities shown in blue for 2016 and 2018 start a little bit later because we're aggregating the values from the previous week. And so we don't have data prior to June 7th that's incorporated into this estimation. And then we're looking at smoothed averages of daily wildfire-specific PM 2.5 over time, comparing in the yellow 2017 to in the gray the average 7-day moving average of wildfire-specific PM 2.5 in 2016 and 2018. And then once again, estimating the excess number, which is slightly higher in this estimation because we've conducted this smoothed average. And then also looking at the attributable fraction, which we see is relatively similar, whether you're using the straightforward average or the 7-day moving average. And so this is a very basic setup. It doesn't require any prior coding knowledge. All you have to do is pull the data in the format that you are interested in into Excel, allows for relatively easy side-by-side visualization of different methods for averaging, and also provides us with an overall estimate of the excess numbers of mortalities that are associated with this wildfire-specific PM 2.5 increase. And maybe we'll head back over to the presentation. And I just want to mention before we move forward with the time series methods that we're going to be discussing in more detail, one of the features that you'll notice from the discussion that we've just had around this excess event methodology is that it's very difficult to estimate confidence intervals. And one of the reasons for that is in order to develop the confidence intervals, you need to have multiple events and you need to run these excess event studies many times. And so that is what would facilitate being able to develop some understanding of what our confidence is in these overall estimates. And so very quickly, if we start to look at multiple discrete events using this excess risk methodology, it becomes very intractable, which is why we're going to move over into time series methods. And I'll hand off to Rachel to get us started on that discussion now.
Thanks, Amruta. Hopefully you're seeing my slides in full screen again. Somebody shout out if that's not the case. As Amruta mentioned, while the excess event study design is really powerful, it has several limitations that some of which we're going to address with time series studies. So like with excess event studies, the objective of time series studies in climate and health research is usually to estimate the change in the count or rate of a certain health event due to an exposure to some kind of climate factor. And in time series studies, a few of the limitations of the excess event studies that we're going to be able to address is that we're going to be able to consider either discrete or continuous climate exposures, whereas the excess event study design is really only appropriate for discrete, well-defined large events. And then we're also going to be able to make use of data from recurring exposures to the same type of event to hopefully get more robust estimates of their effects. And so the time series study design uses data ideally on an exposure and an outcome that are collected over some regular time intervals. So an example of this is from a study of ozone exposure and mortality in London, where for each day during this several year period, the authors collected the daily mean ozone levels in London and the daily number of deaths in London. And so in this study, as in many climate and health studies, the time intervals over which these data are collected is days. That's often the case. And you'll see that we may also need measures of some other potential confounding factors measured over these same regular time intervals that we may need to adjust for in our models. And these data can come from either a single area, as you see here for London, or we could have these time series of both deaths and exposures or health outcomes and exposures collected from multiple areas, and we'll see how to handle both of those situations in the next few slides. And so unlike the excess event study designs The time series study design is going to rely on regression modeling tools to adjust for confounding rather than needing to select this sort of referent or control period. And it provides some added flexibility and a little bit less user discretion. So let's first start with the very simplest time series study design, which is where we just have data from a single area, a single site, over time. So what would our data look like in the time series study design, in this kind of simple time series study design? Well, first, as I said, we'd want to have for our outcome, our health event counts for the given area measured across these regular time intervals. And so for a given time interval T, we're going to denote the health event counts for that time period by this Y subscript T notation. And I promise we won't get too deep into statistical notation here, but we do need a little bit to understand the methods being used. Similarly, we'd like to have exposure measured for those same time intervals that we've measured the health outcome. And so we're going to denote the exposure measures at a given time period T by X sub T. And a reminder that this exposure measure can be binary, it can be multi-category, or it can be continuous. So X could take any of those forms. And then we're also going to sort of present this in the general setting where we have a set of covariates that hopefully measured again at these same time points. And we'll denote this set of covariates measured at a given time point T by C subscript T. So what should this set of covariates C contain? Ideally, C should contain any variables that we suspect could be confounders of the association between our exposure and outcome of interest. So remember, these are factors that are associated with both the exposure and the outcome. And if we don't account for them, we could get biased estimates of the effect of interest. So in climate and health studies, it's very common for potential confounders to be other meteorological variables aside from the particular climate exposure that you're studying. So we'd often want C to include some other meteorological variables. For instance, we saw in the wildfire and health setting, potential meteorological confounder might be temperature or heat. So we would want to measure heat then at the same time points that we've measured exposure and outcome. And we'd include heat ideally in this set of covariates C. In addition to these measured potential confounders in C, the set of covariates for these time series studies often include other what we call structural temporal variables that allow us to account for sort of confounding due to temporal trends in both climate variables and health more generally. And these can be used either in place of or in addition to the measured meteorological variables, since meteorological variables tend to have very structured temporal trends. Sometimes we can, if we haven't actually measured all the necessary potential meteorological confounders, we can get around using those explicitly by using these structural temporal variables. So what I mean by that is we might include a measure of what year we're at time T, what month it is, what season it is, what day of week it is. And so indicators of year, month, season, day of week, things like that might also be included in C to be adjusted for in our models. So let's now talk a little bit about what the modeling would look like in this time series setting. Again, the simplest setting where we just have a single site and we just want to build a model to look at, let's say for now, we just want to look at the association between outcome on a given day and that the exposure of interest on the same day. We'll extend that shortly, but let's assume for now that we just want to look at the effects of same day exposure. So in a typical time series modeling setting, we'd assume that the counts of the health outcome at each time point are YTs, are Poisson distributed, where the Poisson distribution is just a commonly used distribution for count outcome data. And then we'd specify a Poisson regression model that looks something like what's shown here in this line, where we're modeling the expected outcome on time period, or let's say in general, I'll just use the term day rather than time period, but it could be any time period. We're modeling the expected outcome, the expected health event count on day T as a function of exposure on day T and the set of covariates on day T. And so what you can see is that if you've seen linear regression models before, the specification of a linear regression model, this looks pretty much just like the specification of a linear regression model, except for this log function over here on the left-hand side. So we're applying the log function to the expected value of y over here. So this log function is called a log link function, and it's a sort of canonical component of a Poisson regression model. It distinguishes it from kind of a traditional linear regression model. And if you're more familiar with logistic regression, which many folks are, this log link function is analogous to the logit function that we use in logistic regression. And roughly speaking, the role of this log function applied to the expected value of y is that it tells the model that this count outcome should always be non-negative. So it has to always be non-negative. So otherwise, this looks very similar to what we normally see in linear regression. The expected outcome at time t regressed on exposure and a set of covariates also measured at time t. And so then, of course, the quantity of interest from this model is the coefficient, the coefficient parameter associated with exposure. Here we're calling it beta 1. And we can estimate this model to get an estimate of all of the coefficients, but most of interest would be beta 1. We can get these estimates using standard software. We'll show how to do it in R, but any standard software would do this. And I'll note that if you've taken an intro stats class, you're probably familiar with this very restrictive assumption that's made by the Poisson distribution, which is that the Poisson says that the mean of a Poisson random variable should be equal to its variance. And that's a really restrictive assumption that we're not going to delve into in detail here. But I'll just note that that assumption is rarely satisfied when we're working with real health outcome data. And if we impose it on our model, as we will do if we assume the standard Poisson distribution, that can lead to distortion of our estimates of standard errors and other inferential quantities. So in standard software, you can specify what's known as a quasi-Poisson model, or you can alternatively use the negative binomial distribution to relax this mean equals variance assumption and usually obtain more accurate standard error estimates. And we'll show how to do that in software in our example. You can also extend this model to allow for nonlinear associations between the exposure and the outcome by adding polynomial terms on X by using splines, or by simply binning your exposure into some fixed number of categories. So then once we've done model estimation using these techniques, once we've estimated this coefficient of interest, we need to interpret it. And so usually in the linear model setting, recall that we'd usually interpret our coefficients as, a 1 unit increase in exposure is associated with a whatever unit increase in the outcome on average. But here in the Poisson regression setting, we have this log link function that kind of messes with this standard interpretation. And so it turns out that usually the most interpretable quantity that we can sort of easily extract from this Poisson regression model fit is the rate ratio, which we get by exponentiating our estimate of beta 1. And the rate ratio tells us basically the relative change in health events or health rates of the health event per 1 unit change in exposure, in this case, concurrent exposure only, since that's all we've allowed for so far. And so we get the rate ratio, the RR, by exponentiating our beta estimate. And we get a 95% confidence interval for it simply by exponentiating the usual endpoints of a 95% confidence interval for beta. So we just exponentiate the upper and lower confidence limits for beta to get the confidence interval for the rate ratio. And so I'll note that rate ratio values larger than 1 would indicate that the rate of the health event increases as exposure increases. So it would indicate, assuming your health outcome that you're measuring is bad, it would indicate adverse effects of exposure on the health outcome. And RRs less than 1 would indicate that that the rate decreases with exposure, or that exposure is protective, we sometimes say in the epi setting. Sometimes people also convert the RR into an estimate of the percent change in rate of the outcome associated with a 1 unit change in exposure, which we can get just by subtracting 1 from the RR and then multiplying by 100. And so I'm going to go now to demonstrate how we would fit this type of model in our data example. Where, remember, we're trying to look at the association between wildfire attributable PM2.5 concentrations and mortality, quote unquote, although we've already said that it's synthetic mortality data that we're using. And so we'll show how to do this type of time series analysis in R. Recall that our study area is California, and we have data for a 5-year period from every county in California. And we're going to restrict our study period during each of these years to just the wildfire season. So the data that we're going to be using cuts out data from outside the traditional wildfire season. And so our study period is really just going to be combining data from May to October for each of these 5 years. And so our exposure of interest, again, is the real daily county level wildfire PM2.5 concentrations. We showed how you can get those publicly available online. Our outcome is that synthetic daily county level mortality count. And the covariates that we're going to use in this example are just a few of those structural temporal variables that we want to adjust for. So we're going to adjust for month, year, and whether or not a given day is on the weekend, because as Amruta said, there are often strong weekend versus weekday trends in health outcomes. And so we'll first illustrate how to sort of do this time series analysis for a single county. We'll focus on LA County, as Amruta did in her example. And then we'll show, for instance, how you could repeat this type of analysis, the code to repeat this type of analysis for all the counties in the data set. And I believe the link to the code was posted, to the code on GitHub was posted in the chat earlier, but let us know if you need that again. So first thing here, hopefully you're seeing my code. First thing I'm going to do is load some packages that are going to help me to do these analyses. And then I'm going to read in the data where this data set that I'm reading in already has merged the wildfire PM2.5 concentrations for each day with the mortality counts for each day for each county. So just to give you a sense of the data structure, this first column in the data set is our county identifier. So the values of this variable sort of uniquely identify counties. The second column is our date, telling us what day each observation corresponds to. The X variable here is the wildfire PM2.5 concentration. Of course, most of the time it's 0 because on most days there isn't wildfire PM overhead. And our outcome is given in this outcome column, which is again the synthetic mortality counts for each county and day. So you can see that our data are structured into what we call long form, where each row corresponds to a given county and day. And so this is usually the simplest way to work with time series data is to put it into this long form. So first thing we're going to do is just add a few of those structural temporal variables into the data set, because note that while our data set has the date in it, we still need to pull out, for instance, like what day of the week this day is. We need to pull out the year. And so there's a nice package in R called Lubridate that really is helpful for pulling out these like structural temporal variables from dates. So you can, for instance, use the month command applied to the date column in your data set to pull out a new variable that tells you which month each one of these observations corresponds to. Similarly for the year function in Lubridate. Note that I said that we were going to focus only on days during wildfire season. So here I'm just subsetting the data to drop all of the days that are outside of the traditional wildfire season of May to October. And again, using Lubridate functions to extract what day of the week each date corresponds to, and then create an indicator of whether each of those days is a weekend day or not, because remember, we're going to adjust for a weekend indicator as a structural temporal variable in our models. So let's take another look at the data now that I've made these, I've taken these basic data processing steps. So now, in addition to the 4 columns we had to start out, we now have a column that tells us what month each observation falls in, what year, what day of week, and then a binary indicator of whether that day is a weekend day or not. So now with our data in this format, we can start by sort of pulling out the data for just LA County, which I said we're going to start by showing how to fit these models for just a single county at a time. And we're going to use the LA County example. So first, just extracting the data for LA County, where I know it's county identifier here, and I've used that to subset the data to just the data for that county. So the data set now is just subsetted to include only days for LA County. And then this simple line here is all you need to actually fit the time series model once you've done that data processing work. Here we're applying the GLM function, generalized linear model function, in R to fit a quasi-Poisson model. Remember, we said that the quasi-Poisson approach relaxes that mean variance assumption of the standard Poisson distribution, allows us to get more accurate standard errors and inferential quantities. And so, to fit this quasi-Poisson model, the first input that you give to the GLM function is just your formula telling R what your outcome is, and then separating that from the variables on the right-hand side of the model, your predictors, your exposure and covariates, using a tilde. So outcome tilde, the sum of the predictors. So the sum of the variables on the right-hand side of the model. This is a standard sort of formula argument from R that you would use, for instance, even in a standard linear model setting. So it looks analogous to how you would specify the formula for a linear model to fit in R. Then you, at the second argument, you tell it which data set that it should pull these variables from. So that's our subsetted data to LA County. And then the last argument is you tell it what type of model you want, which here we want the quasi-Poisson model. So we say family equals, after the equals, we tell it what model type we want, which here is the quasi-Poisson. So can fit this model. And then to inspect the output, we just print the summary of the model object. And that tells us our coefficient estimates and the associated standard errors and p-values for each of them. So in particular, of course, our interest is in that rate ratio for exposure, for wildfire exposure. And so this little bit of code here just goes in and pulls out the rate ratio, which remember is the exponentiated coefficient estimate associated with exposure and its corresponding confidence interval. And so you can see here that when we exponentiate, we get the rate ratio for exposure, which is 1.008. So it's a number greater than 1, which would, as we said, indicate that exposure is has a harmful impact on health. And because the null value of 1 is not included in the 95% confidence interval, we might conclude that this is a significant effect on the health outcome. So Amruta is going to talk us more through how to deal with a multi-county study design shortly in the next few slides. But I just want to note that the idea is pretty simple for dealing with multi-site time series data. Typically what's done is actually first separate time series models are fit for each site. So you would go through and separately fit these models for each site, in our case, each county in the data, and then combine those estimates from each site or each county using a meta-analysis that Amruta is going to talk about. So here I'm just showing you quickly how you would fit this same model, go through this same process and fit this time series model for all of the counties in the data. So we have data for each county in California. And basically all you're doing with this code is just looping through, and for each one of the counties, subsetting the data to only the data from that county, fitting the model on the time series data for that county, and then just exporting the output. And so you can do this to fit models for all the counties. I actually, in the code that you can check out on GitHub, I list a couple of different coding options to get those effect estimates for all the counties. So there are a number of different approaches in the code that you can use to sort of loop through all of the counties. And then here I'm just saving the output for all of the counties and exporting it to an external file, so that, for instance, if you wanted to visualize the effect estimates using another software like Flourish that Heather showed us earlier, you could then export the results and visualize them in another software if you wanted. For simplicity here, I'm just going to do a quick visualization in R so that you can get a sense of what the estimates look like for each county. Oops. So here you're seeing, I think, for each county, the rate ratio and 95% confidence interval, where the vertical line here is at 1. And so you can see that for most counties, their rate ratios are greater than 1, and their confidence intervals don't include 1. So we would usually say that that for most of the counties, there's a significant effect of wildfire, a significant adverse effect of wildfire PM concentrations on mortality. Of course, this is synthetic data, so these aren't real associations. But we do notice that there are some counties for which we don't see any effect, although I believe even the rate ratio estimates that are less than 1, they're not statistically significant because their confidence intervals do overlap 1, they overlap the null. So again, Amruta is going to show us shortly how we can take this huge amount of output from all of the different counties and condense it into one sort of overall estimate of the effect of wildfire PM 2.5 on mortality. Before we get there, I just want to quickly tell you about a couple of extensions that you might use of this model.
Sorry, Rachel, I was actually going to ask, do you mind if we flip the order so that I can share the multi-county analysis? Just in the interest of time, I want to make sure that we're able to share the multiple counties. Great.
Right. Amruta has to jump off a little bit early. So we will just jump straight to how to do the combining of the time series estimates from multiple sites. Let me get this back into slideshow.
Wonderful. Thank you so much, Rachel. So as Rachel has shown you in her example, commonly what we have is values for exposures and outcomes and time series evidence from multiple locations. And what we're looking for is a way to, with statistical accuracy, combine across these different locations, understanding that there may be some features of the data that aren't exactly matching across these different locations. So for example, we might have some counties that have wider confidence intervals because there's fewer wildfire days, or we may have some counties that have wider confidence intervals because the population size is relatively smaller compared to locations where we have a much larger population. So we would like to estimate in our case a average rate ratio across these different sites. So as Rachel was saying, the usual approach is to fit a separate time series model to each of the single sites that are included, and then use a meta-analysis in order to estimate the overall effect and standard error. And this is similar to a meta-analysis that you might see across multiple clinical trials, where you're trying to combine the effect estimates that are generated for different individual clinical trials into a single overall understanding of the efficacy of a drug, for example. Alternatively, in our example, you could just use all of the data to build a single regression model for the entire state of California, as an example, using all of the sites and including a site-specific indicator as a covariate within your model. But this is going to give you a lot less flexibility as compared with our meta-analysis approaches that we have available. Next slide, please. So here we have an example from a study across different cities in Canada looking at the relationship between different air pollutants and acute angina and myocardial infarction within these different communities. And what we've shown is that simple random effects meta-analysis pools the estimates across these different sites, taking a weighted average of the estimates, which have been weighted by their statistical precision, measured by either the variance or the standard error. In R, you can implement this really easily using a package called MixMeta. There have been a couple of different versions of this package or different implementations of meta-analysis that have been really useful for time series epidemiology, but MixMeta is the one that's recommended currently. And so I think we'll move back over into the R code. Oh, sorry, no, we're going to talk a little bit about the different methods for generating these estimates across multiple sites. So there are different types of models. There's fixed effects models and random effects models. And this is something that hopefully some of you have some understanding of these concepts from previous statistical courses. But one of the things that I just want to mention about these different modeling types is that fixed effects models don't assume heterogeneity across studies. So the estimates are conditional on the set of studies. So in our case, the county-specific estimates that are collected during the meta-analysis. By comparison, random effects meta-analysis allows some degree of heterogeneity among studies, assuming that county-specific outcomes are randomly sampled from a usually hypothetical population of a lot of different counties. So in a unified modeling framework, we can assess the meta-analysis as a linear mixed effects model. So this is something that we're going to talk about in a little bit more detail in terms of the ways that we could meta-analyze for fixed effects versus random effects models. There are a couple of different ways, next slide please, that are recommended within the mixed meta package. So for fixed effects models, those are usually fitted through a generalized least squares model, assuming that the covariance structure is completely known. By comparison, for random effects estimators, those include maximum likelihood estimation or restricted maximum likelihood estimation. These are likelihood-based random effects estimators representing the most common comprehensive implementation of the linear mixed effects modeling framework. So this is where we're going to be focused in our analysis using maximum likelihood estimation in our case. By comparison, you have some semi-parametric methods, including the method of moments and the variance components methods, but these are only available for models with a very basic random effect structure. So, we don't have the assumption that we completely know our covariance structure in our model, and we also don't have a basic random effect structure, so we'll go with this intermediate of the maximum likelihood estimation method. So I think we can switch over now back into the R code. And this is actually relatively very simple. So in the estimation of the rate ratios that Rachel conducted previously, looking across all of the different counties, which we showed in the figure, we were actually able to pull out not only the rate ratio estimate and the standard error estimates, we also pulled out the variance of those estimates. And this is a component of the model that's available from the generalized linear model. And we've pulled it out into our data set that contains the rate ratio estimates and the standard error estimates as well. So leveraging that variance, because as we mentioned, we're weighting each county based on the accuracy of the estimate and the data that's going in for each of the counties using the variance information, we're able to just use the mixed meta function, pulling in the rate ratio estimates and the variance of those estimates, and using that ML method that we've talked about for random effects. And what this provides us with is the estimate of across all of the different counties and across all of the different individual quasi-Poisson models that we've built, what is the overall estimate of the impact of wildfire-specific PM2.5 on the health outcome, in our case, the synthetic mortality data. And we can use the print function to just show that across all of the different counties, we do see an increase in the rate ratio of mortalities associated with increasing exposure to wildfire-specific PM2.5. One of the things that you might have noticed in the figure is that there's one specific county, and we'll pop open the figure so that we can take a look. It's very handy to be able to investigate all of the different effect estimates that we've seen across these different counties. We see one county towards the bottom of the figure that seems like it might be very influential in the overall estimate of the relationship between wildfire-specific exposures and the health outcome of interest. And it seems to be showing a protective effect. But one of the things that we notice is that the confidence interval is quite wide for this one county. And we don't know, there may be features of that county that are leading to this very wide confidence interval. Perhaps it's a very small county that doesn't have a lot of sample size in order to inform the model. So one of the things we might be concerned about is this effect estimate that seems to be quite protective having an impact on the overall effect estimate that we're obtaining from our meta-analysis? So in order to understand that, we reran the meta-analysis, just excluding the data from this particular county, so that we can try and remove its influence and see what happens to our effect estimate. And what we find when we've done that is that we don't see that much of a difference between the new exposure response that we see, approximately 1.005, removing that county that might have been influential. And then maybe, Rachel, if you can scroll up a little bit in the results, we might be able to see, sorry, if you don't mind scrolling up in your console, so that we can do the comparison with the previous. So we see that this was including that particular county. So we don't, because we've used this meta-analysis method, we've provided an estimate of the overall association between the wildfire-specific PM2.5 and the mortality outcome that's relatively stable, even as we bring in additional data that may or may not have a significant sample size, or that we might be concerned in a straightforward averaging might overly influence our estimate of the association. And so I think those are some of the important features of being able to run the meta-analysis using this weighting that's based on the variance of these estimates. And in this figure, which is a new version of the previous figure, we've just included the meta-analysis as the very first line, followed by all of the different county-specific estimates, so that you can see where the overall meta-analysis has brought us in terms of our understanding of the exposure response, compared with all of the different counties that we have in the data set, and building the individual models and estimating the exposure response for each of those individual counties. And it's not going to be as extreme as the most extreme counties, and it's also not going to be as potentially protective of an effect as we see in some of those counties with the wider confidence intervals. So maybe we can shift back over to the PowerPoint.
Sure.
Wonderful. So, sorry, go ahead.
Were there more things you wanted to say, or should I go back and loop back to the nonlinearity piece?
I think if you want to loop back to the nonlinearity, that would be great. Sure.
Thanks, Amruta.
Mm-hmm.
So let's see. Okay, so this what you've seen so far is how to do a simple time series model for a single site, and then how to do the multi-site analysis where you do separate models, you fit separate models for each site, in our case, each county, and then meta-analyze them if you want to get an overall effect that lets you, have both, understand both a sort of overall effect across sites and the site-specific heterogeneity. There are other extensions of the simple time series model that come in really handy in climate and health settings. So one of them, thinking back, remember our model. So far, we've just been assuming a linear association between the exposure and the outcome. But we know that in climate and health, many continuous exposures are non-linearly related to health outcomes. So what do we mean by non-linearly related? We mean that a 1 unit change in exposure is not associated with the same change in the outcome for all sort of starting points of exposure. So for instance, going from an exposure of 5 to 6 of wildfire smoke particulate matter might have a different effect on health than going from an exposure of 39 to 40. And so that would indicate that there's a nonlinear relationship between the exposure and the outcome. And a recent study of the association between wildfire smoke PM2.5 and emergency department visits showed that the relationship between wildfire smoke and ED visits is highly nonlinear. So this study that was recently published used a time series approach, and they included a 4th degree polynomial term on the wildfire smoke concentration variable in their model. So again, kind of going back to our model, instead of just having our exposure variable linearly related, they had polynomial terms, 4th degree polynomial terms on exposure in their model. And They could alternatively have sort of characterized nonlinear associations between the exposure and the outcome using splines, or they could have broken the exposure, binned it into some kind of ordered categories. So this type of time series model can accommodate any of those ways of characterizing nonlinearity. Here, they chose to use polynomial terms on the exposure, and that allowed them to see this really, really nonlinear relationship between wildfire smoke concentrations and emergency department visits. In particular, they see that emergency department visits increase with increasing smoke at low levels, but then decrease at higher levels. So over here, an increase in exposure is associated with an increase in ED visits. But once you get out here to higher levels of smoke, an increase in exposure is associated with a decrease in ED visits. So why would this happen? They did some more digging in data in this study and found that this decrease that we see at higher levels is due to behavioral changes that people make during dense smoke episodes. So when people can actually see the wildfire smoke outside, they change their behavior in ways that is actually overall protective of health. For instance, if you see that it's very smoky outside and you don't go outside and you don't get in your car and drive somewhere, you're less likely to, for instance, get in a car accident or something like that. And so that leads to, at high levels, when people make those behavioral changes, an overall decrease in emergency department visits. So the time series model can allow us to see these nonlinear trends for continuous variables. Time series studies also allow us to look at lagged effect of exposures. What do we mean by lagged effects? So many exposures have delayed effects on health. So they may have an effect both on the day that you're exposed and a few days after. And we might want to understand not only how those concurrent exposures affect health, but also how your exposures over the past few days affect health. And so time series studies can allow us to formally model both same day and prior day effects, or what we often call lagged effects. So how would we do this? How would we extend our model to allow for these lagged effects? So let's suppose that we want to estimate the effects of exposure on the same day. So the same day as we're looking at the health outcome, as well as the effects of exposure on each of the previous capital L days on the health outcome today. And L here, the number of lag days that you choose to look at, would be selected by the user, ideally based on some substantive knowledge or substantive information about how long we think the effects of this exposure might be delayed. So in this case, we would just modify our Poisson regression model from several slides back very slightly to accommodate the exposures on each of the previous capital L days. So this looks like the Poisson regression model that we saw before. We're modeling the we're modeling the expected outcome on day T as a function of exposure on day T, same day exposure, and the covariates. The only new piece is this piece here, which sums over all of the lag days, 1 to L, the exposure on each of those days. So this is just the sum of the exposures, the concentration levels on each of the previous L days prior to day T. And then, of course, they have their associated, each of the days of exposure have their associated regression coefficients. And these regression coefficients, the betas here associated with the lagged exposures are often referred to as lagged effects of the exposure. And what you often see in time series studies is a plot like the one shown up here, where you exponentiate your same day effect estimate, your beta 1 estimate, and the estimate of these betas associated with the lagged exposures. to get the relative risks, to get the rate ratios corresponding to each one of the same day and lag day exposures. Okay, so skipping back through the time series stuff. A few last notes about time series modeling are related to sort of more rigorous adjustment for potential temporal trends in your data. So in our real data or quasi-real data example, remember that we adjusted for month of year and year in our model. But what if we think that just sort of independently adjusting for a month of year and year might not be enough to adjust for the temporal trends in other meteorology beyond wildfire smoke and potentially other temporal trends in health outcomes, and therefore eliminate the confounding effects? So an example of this is that even though we're adjusting for a month in our model, within month meteorological trends might still confound the effects of wildfire smoke. So for instance, even within the month of May, we know that there are probably trends in temperature, right? As we go further through May in the US, the temperature is getting hotter. And also later in May, we're probably more likely to have wildfires. And so even within the month of May, even once we've adjusted for May, we still might have meteorological trends that are further confounding, still confounding the effects that we're seeing from this model. There can also be changes in the size of the baseline population at risk. I think Amruta alluded to this earlier. So the size of the population that's captured by your time series. This can also change dramatically over time in a way that can sometimes confound your effects of interest. And so let's suppose that we want to do sort of, again, more robust and rigorous adjustment for these possible additional temporal trends that might exist in our data. And to do that, we want to adjust our models for study week. So we would include in our model indicators of study week to better adjust for these possible temporal confounders. And let's, for the purposes of the next few slides, let's just refer to each study week as a stratum. So we need to adjust for indicators of strata to further adjust for temporal trends. So we could just throw indicators of strata into our regression model, indicators of study week into our regression model. But doing this would be pretty computationally costly because it requires us to estimate coefficients for each of many strata indicators. So in the case where we're adjusting for a study week indicator, there might be 50, 100 or more of those in our model. So depending on how many weeks of data we include. So it could be very computationally costly to fit this model adjusted for strata. So an alternative option that turns out to give the same estimates of the quantities of interest, but avoids this computational burden is the conditional Poisson or quasi-Poisson regression model. This conditional Poisson or quasi-Poisson mitigates the computational demands imposed by adjusting for all of these strata indicators by using a statistical trick that we're not going to go into detail about here because we don't have time and it's pretty statistically involved. But the nice thing is that we can use this conditional Poisson or quasi-Poisson model to still estimate the effective exposure adjusted for strata but without actually needing to estimate the coefficients associated with strata. So it averts that computational demand. And it turns out that it gives estimates and inference for our exposure variable of interest that are identical to what we would have gotten if we just fit the usual Poisson or quasi-Poisson model, formally adjusted for strata and estimating the coefficients for each stratum. And another thing that's appealing in many cases about this conditional Poisson regression model is that it can be shown to be equivalent under certain conditions to another commonly used study design that we haven't had time to talk about here today, called the case crossover study design that's used a lot in short-term climate and health effect studies. And this conditional quasi-Poisson regression model can be easily fit in R using the GNM package and GNM function within that package. And I see that we're a little low on time. I was going to show the example of this in the real data, but I think I'll skip that due to lack of time. But you can see how to implement this conditional quasi-Poisson model if you go to the code that we linked in GitHub for our data example. So just to wrap up on the time series studies, so we saw that compared to the excess event studies that Amruta talked about earlier, some of the reasons that we might want to use time series studies instead are that we can take this multi-site approach that allows us to both understand heterogeneity in the effects of climate exposures on health across multiple locations, and also still get this overall effect that we can report that's pooled across all the locations. So we can understand heterogeneity while still getting overall effect estimates. We also saw that the time series study design allows for continuous exposures, and we didn't show this in our example, but we noted that it can accommodate nonlinear and lagged effects of exposures. It also uses regression modeling to adjust for confounding, in contrast to the excess event design, which requires the user to sort of select some control periods, and it involves some discretion, whereas the use of regression modeling is a little bit more standardized. And as we saw, it provides sort of formal options for doing statistical inference, whereas as Amruta noted, that's a bit tougher in the excess event design. The downsides compared to the excess event design are that it's a little bit less methodologically transparent. Poisson regression models are a little bit more complicated than just taking differences. And it also, if we want to understand the heterogeneity across space, it requires spatially stratified data, and that can particularly spatially stratified health data can be really difficult to get your hands on just because of privacy restrictions. So I see that there are questions in the chat, but I'm thinking it might make sense to finish out giving you a preview of the anticipated future cafe educational offerings that you can be on the lookout for in the coming months. And then we can do questions at the end, but let me know if folks have objections to that structure. So one thing that we want to cover in future cafe educational trainings is methods and study designs for studies of chronic effects of climate exposures. So as I said at the beginning, chronic effect studies require a totally different set of methods and designs than these short-term studies that we've been talking about. In particular, they often rely on cohort study designs, which require a whole different slew of analytic methods than the ones we discussed here. They're also considered to be a little bit more challenging and subject to stronger potential confounding effects, because in these chronic effect studies, we typically rely more on variability and exposure and outcome across individuals or across space. and less on variability across time. And that can lend itself to stronger confounding because individuals tend to be more systematically different from one another than does the same set of individuals tracked across time. And so those systematic differences lead to sort of stronger potential for confounding. Also, these types of studies are complicated because over a long period of time that you need to follow people up to see chronic effects of an exposure, a lot of things change independent of exposure. And so it can be quite hard to disentangle the effects of exposure from other factors that are changing over time. So as you can imagine, then these types of studies are much less common in the literature, and most of what's been done, to my knowledge, has focused on the chronic health effects of a single large event. Like, for instance, quite a few studies like this have been conducted for chronic effects of Hurricane Katrina exposure. There's also a recent nice example of this chronic effect studies in the multi-event setting, looking at the effects of drought exposure on mortality. We also noted in our early survey of the community of practice that a lot of community of practice members are interested in learning more causal inference methods specifically. So just do want to note first that many of the methods covered here can be considered causal methods under certain assumptions about the health effect and confounding structures. So I don't want to suggest that you couldn't do causal inference with the designs and methods that we've discussed here today. It just requires being a little bit more formal about your assumptions. And there's also a whole body of causal inference specific literature that's focused on trying to adjust for confounding and extract causal inferences from observational designs. So in the future, we hope to sort of more explicitly bring in the language and concepts and techniques from this quote unquote causal inference literature into our educational offerings. And so with the remaining time, we'd love to get your all's feedback on the what gaps that you've seen exist in free online climate and health education or training resources, because we are trying to create a roadmap for the types of education and training resources that we want to develop with CAFE over the next few years. And so it would be really helpful to hear from you guys about the gaps that you've noticed in, again, what's available free and online, so accessible to all. So that we can consider that when we're sort of forming our agenda for creation of these resources. Other announcements from the capacity building function, which Pat Kinney and I are co-leading, is that we're now accepting pilot grant applications. The pilot grant program of CAFE is run through the capacity building function. And so we have the RFA out now for the pilot grants, and the due date for those to submit your application for those is March 15th. And if you have specific questions about pilot grants, you can actually right now, 3 to 4 p.m., join the roundtable that's going on for the pilot grant applications that is being manned by John Levy and Pam Templer, who are leading the pilot grant program. So encourage you to jump over to that roundtable if you're thinking about submitting a pilot. Also, in the coming months, in addition to developing more education and training resources that we hope to make available free and online, we're also trying to build out a climate and health research mentorship network. And so we hope to have more details on that to come on our website and in communications from CAFE. And that is all I have. Pat, did you want to say anything else before we sort of discuss any questions?
No, I don't think so. There's some good questions in the various chats. I don't have them all here because I was away for a minute and came back.
Gotcha.
Joshua has been asking about some missing input data. He's trying to run the R script. I don't know if that's something, but you could at least look at what he said, and then if you have a quick answer, otherwise we could go
Yeah,
back.
so I think the issue is that the data need to be merged with the climate data. So I wasn't able to repost the climate data on the Dataverse. And so you'll have to go to the wildfire data source, which is another website that I believe we linked to, download that data and then merge it with the outcome data that you're able to access on the Dataverse to get the sort of merged data set that I was using in the example. Yeah, it's a good point.
Okay.
You see, there are a lot of questions. I'm not quite sure where to start. I don't think we'll be able to get through all of these in the time remaining. So I'm going to start with the question about selecting. Somebody says, is selecting certain months the continuity of the time series is broken and it might be difficult to reflect the different spacing. So if you were formally including like a day of study variable in your models, and you were including it sort of as a if you were sort of using a continuous measure of time in your models, I think that would be true, that you would have to watch out for just taking out huge chunks of time. In this example, we were never actually using a continuous measure of time. So that's a great point, that it gets a little hairier if you're sort of using a continuous time measure and you're cutting out chunks of data or chunks of time, for instance, due to like seasonal exposures. So that's a great point. There's a question of what if the rate ratio, I always want to say relative risk, what if the rate ratio of exposure is 1.001 with a confidence interval just below 1, the lower confidence bound just below 1. Yeah, I mean, I would say that there's been a move in the epidemiologic community away from just purely using these sort of various measures of statistical significance to gauge strength of evidence. So I would say if you have a large data set and you're pretty and you think your results are robust, it's probably still safe to say there's evidence of an association, even if technically the lower confidence limit is below the null value. I think increasingly that's sort of an accepted practice in the environmental epi literature, at least, to sort of acknowledge effect estimates that appear to be strong, even if they're technically not statistically significant. I'm sure there are other opinions on that.
There's one I see that Zach just highlighted, is down towards the very bottom of the list, that about the fact that many exposure measures are at the group level, whereas some, I mean, if you have individual data, some confounders may be at the individual level. It says, what are the design/statistical methods to address this when you have, I guess, data from different levels of organization? That's a very common thing in environmental.
Yeah, I would say that the approach that I've seen most commonly used, maybe in some of the more impactful studies, is to sort of analyze your data at the individual level and just assign You know, if all you have is a group level exposure or a group level measure for some variables, just assign those measures to everybody in the group, and still analyze the data at the at the individual level. That's typically preferred, because if you have individual level data and you have some information on individuals that could help you further adjust for confounding, it's typically preferred to keep the data at that level, I think. Also, you often, when you aggregate everything, as we've done in this study, you do often get criticisms of ecologic bias and things like that, which we didn't have time to go into here today. So if you do have individual level data, my recommendation would probably be to analyze it at the individual level, and assign your sort of aggregate exposures as appropriate to all the individuals within a given group. I don't know if Pat has other thoughts.
No, I agree with that. Maybe I
would
can
say also, just to formally acknowledge this is an ongoing area of research of like how to combine aggregate and individual level data sources. And so we actually have a PhD student in our group working on this question. So it's an active area of research, and there are sort of more modern methods out there to more formally handle this, and account for the sort of statistical uncertainty that comes from having some aggregate variables in your model. And so there are more formal ways of dealing with it, but not that I can easily explain here in a few minutes.
Yeah. I came from a background in air pollution epidemiology, and exposure assessment has always been kind of ecological in those studies. In other words, group level, even city level, you know, quite coarse. I think one move in the air pollution field, one development is towards more highly resolved spatial estimates of air pollution. But still, and in spite of the fact that low-cost sensors are increasingly available, they still haven't really cracked into like large-scale epidemiology studies in a way that like it's not yet changing our exposure assessment down to the individual level, getting it down to the individual level, unfortunately. I think with temperature, you know, measuring temperature is a little bit cheaper than measuring air pollution. So I think individual level temperature measures may be something we could start to move towards in some way. But anyway, it's still going to be a problem for some time, but it's a good research problem for young investigators to try to deal with. I had posed a question, Rachel, which I'll dig up here. It's something that's been nagging me for a long time, but I've never had a chance to really ask a statistician the question. So I'll just read it. So given your comment about within-month confounding potential, do you worry about case crossover models that use month-stratified controls? I've been concerned that within-month control would be biased for days near the beginning and the end of the month, for which the monthly mean isn't a good estimate. You know, when you have a strongly trending thing like temperature in the springtime, or mortality, you know, in the spring and the fall. Like, I'm worried about sort of the opposing trends of those things. Have you ever thought about that?
Yeah, we're thinking about that right now, where we actually have some real data examples where it really matters if you like how you pick your set of controls, if you pick them sort of within month, if you force them to be within the same month as the case day, or if you allow them to go sort of bidirectionally on both ends and go outside the month, you get really, really, really different, like going in totally opposite directions answers. And I feel like we've made a little bit of progress in thinking about why that's happening, but I don't want to speak sort of decisively on it, because I think it's still kind of an open area, and we're not 100% certain that we've cracked it. We seem to be finding that if you're using the bidirectional design and not constraining your controls to be within the same month as the cases, usually the bias tends to, like, you're getting some bias, as you say, from the within month, because usually you're picking, even if you don't restrict your controls to be within month, usually you're roughly picking them in similar months around the same time of the case. And so we found that typically, if you have that scenario, then of course, let's say you're working in a temperature setting, I guess, I'm not being articulate here, because it's a really hard question. But we found that in summary, the bias on both ends kind of cancels each other out from these within month trends is basically the long and short of it. So you get bias in one direction from like the left end and one direction from the right end. And then we're finding that it often like cancels each other out. So I'm sure that would depend on exactly how you defined your study period though.
That's been my intuition, because the case crossover results always compare pretty well with the time series method. So like I figured it can't be too biased, and maybe it's offsetting bias. So maybe that's the answer. But look forward to hearing more as your work continues in that question. Are there any other, Zach, have you got any other questions that we ought to pose to Rachel?
I think that the only other two questions that we have are about any epi studies that would be accessible and good to point people towards, or a good environmental epi textbook relevant to climate change. And I'll also just highlight that the Whova chat will be active after the session, if it would be useful to share links offline after the session.
Also, so you had some references on some of your slides, including at the end, and so to share those somehow.
Yeah, I think that would be the best option. For the stuff that we covered today, there are a few really good papers that I cite, like more educational papers in the set of references on sort of general approaches to time series studies and to meta-analysis of multi-site time series. So would encourage you to, once we get a chance to post these on the Whova site, these slides, to take a look at the references there. Pat, you might know better than me about like environmental epi textbooks.
Well, there have been a few climate and health books that that propose to be textbooks. I haven't yet found one that I think is really like up to date enough, because there's like a lag with textbooks. I think and the field is changing rapidly, so I tend to fall back towards the emerging literature as the kind of source for, especially in my class where I'm teaching this kind of stuff.
Yeah,
so I'm still on the lookout for a textbook, but maybe there could be like an online, like readily updated version of a textbook at some point that could serve that purpose.
And I will say, just shameless plug, we are, as part of the CAFE capacity building function, developing a list of existing education and training resources that are freely available online. Oh, I see Elaine's telling us to wrap up. So keep an eye out for that on the CAFE website.
Thanks.
Thank you, everybody.
Everybody else, this was a great session.
Yeah, thanks.
Thank you.